Salah Bu. Apa namanya? Dikena kok merah ini. Masa mau dimatikan takut nanti udah
Public Health International Conference, or commonly called PICO, is an annual conference held by Faculty of Public Health, Universitas Sumatera Utara. PICO provides opportunities for lecturers and researchers to disseminate ideas and research results in public health. The first PICO with the theme Tropical Health and Universal Coverage was held on 1st and 2nd December 2016 at Grandika Hotel Medan. The second PICO with the theme Public Health, Tropical, Global Environmental Change and Quality of Life was held on 26 and 27 December 2017 at GW Marriott Hotel Medan. The third PICO with 10 public health intervention on facing threats global health in tropical area was held on 14 and 15 November 2018 at Grandika Hotel Medan. Now, it's the time for the fourth PICO. Due to COVID-19 pandemic, this conference will be held virtually on 17 and 18 September 2021. This pandemic never prevented us to be productive through the research activity. Many scientists and educators from all around the world will gather and discuss about the current studies. Keynote speaker, Dr. Arturo M. Persigan, WHO Deputy Director. And the invited speaker, Associate Professor Supaporn Sutnongbua PhD. Professor Dr. Sonu Goel, Professor Dr. K.M. Zabanowska, Professor Chang Chuan Chan.
Assalamualaikum warahmatullahi wabarakatuh. Hello, I am Professor Ida Justina. I am the Dean of Faculty of Public Health, Universitas Sumatera Utara. I would like to say welcome to the 4th Public Health International Conference, PICO. This conference supports the vision of the Public Health Faculty to become an international standard faculty in developing public health science. Thank you to all those who have participated and supported the implementation of this conference. Hopefully, this conference can be useful for all parties. FKM USU? Yes, yes, yes. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. I am Dr. Fajida Aguslina Siregar, the General Chair of the 4th Public Health International Conference. It's my pleasure to welcome all of you, the participants, and all the eminent speakers from all around the world. It's an honor for us, the host of Public Health International Conference in this pandemic situation. I wish we have a great discussion with outstanding researchers from different countries around the world and sharing new and existing results related to the public health issue. On behalf of the Public Health International Conference Committee, I also would like to express my appreciation to all of you who helped us and make this event become a success. Finally, I would like to say welcome and enjoy the conference. Assalamualaikum warahmatullahi wabarakatuh.
This conference is supporting by Please welcome to the 4th Public Health International Conference.
Roses are red, violets are blue. From Medan, with warm-hearted, both of us will greet you.
Assalamualaikum warahmatullahi wabarakatuh. Morning, ladies and gentlemen. Welcome to the opening ceremony of the 4th Public Health International Conference 2021. Wow, I'm so glad to be here. How about you, Iza?
Me too, I'm so excited. The 4th Public Health International Conference, or known as PICO, is an event held by Faculty of Public Health, Universitas Sumatera Utara. This year, we have themed the role of public health in empowering society in managing COVID-19 pandemic. We will meet virtually through the Zoom meeting from today, 17 until 18 September 2021.
All right. This conference will assist you to share knowledge, experience, and idea in handling COVID-19 from international expert speaker. On behalf of organizing committee of PICO, we would like to express our warm welcome to all of you who are participating and hope you will enjoy this conference.
And during the opening ceremony, we would like to remind you to turn on your camera and mute your audio.
Now we are going to say hello to all our audience who come from Indonesia, Malaysia, India, Netherlands, and Taiwan. And also welcome to
Dia
other
pun malu.
audience that we cannot mention your country one by one, but we do really hope we always in good condition, stay safe, and good luck for this conference.
Before the beginning the whole session, let us first introduce ourselves. As the master of ceremony, my name is Iza and my partner.
And my name is Echia.
We will accompany you to the opening ceremony of the 4th Public Health International Conference 2021.
All right. First of all, let's thank to Allah Subhanahu wa Ta'ala who has given us His mercy and blessing, so we can attend this conference without any problem. Even though we are still in the pandemic situation, we should be confident to fight this with our creativity.
Yes, of course. So, the Honorable Director of Universitas Sumatera Utara, Dr. Murianto Amin SOS MSc, and all the Vice Rector, Dean of Public Health Faculty Universitas Sumatera Utara, Professor Dr. Randa Ida Justina MSc, and all the Vice Dean, General Chair of the 4th Public Health International Conference, Dr. Fazida Aguslina Siregar MKes PhD, international collaborate participant from University Kebangsaan Malaysia and University Putra Malaysia, and all academic community of Public Health Faculty Universitas Sumatera Utara.
And also our keynote speaker, Dr. Arturo M. Pesigan from WHO Deputy Director, and the Honorable our speaker, Professor Sonukul from India, Professor Chang Chuan Chan from Taiwan, and Associate Professor Supaporn Donghua PhD from Thailand, and the last one is Professor K.M. Zabanuska from Netherlands.
And here are the series of the activity opening ceremony of PICO 2021. First, opening remarks by us, and then continue with UR recital.
singing national anthem Indonesia Raya and hymn Universitas Sumatera Utara,
Welcoming speech by General Chair of IPLO,
speech by Dean of Public Health Faculty Universitas Sumatera Utara,
opening speech by Rector Universitas Sumatera Utara, and continue with performing traditional dance.
and after that we have keynote speech session.
After that, we will have plenary session 1 and continue with break.
And after the break, we'll continue with the plenary session 2. And the last is closing the first day of this conference.
So, before we start our conference, let us pay attention first for recite dua. Please welcome Mr. Mukti Yuda Pratama to deliver recite dua. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, let us bow our head for a moment. Pray to God, Allah Subhanahu wa Ta'ala, so that our international conference can be precious to all of us. I will lead this prayer based on teaching of Islam, and those who are not Muslims are pleased to pray according to each of your benefits. A'udzu billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Wa bihi nasta'inu ala umurid dunya waddin. Wassalatu wassalamu ala asrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Allahumma salli ala sayyidina Muhammadin tibbil qulubi wa dawaiha wa afiyati abdani wa shifaiha wa nuril absari wa diyaiha wa ala alihi wa sahbihi wa barik wa sallim. Ya Allah, today we gather here to hold the 4th Public Health International Conference, Faculty of Public Health, Universitas Sumatera Utara. Make this international conference as a medium of sharing useful ideas, knowledge, and experience for us. Ya Allah, may the conference we hold today be useful for us, increase our knowledge and ideas, and lead us to become successful people. Allahumma inni a'udzubika minal hammi wal hazan, wa a'udzubika minal ajzi wal kasal, wa a'udzubika minal jubni wal bukhal, wa a'udzubika min khalabati daini wa qahri rijal. Ya Allah, guide and bless our hearts and minds with the radiance of your guidance. Help us to speak our talk clearly. Help us to listen and respect each other, so that we are among those who are blessed. Ya Allah, Ya Rabbal Alamin, you are the one who can fulfill our prayer. Rabbana atina min ladunka rahmatan wa hayyi' lana min amrina rasyada. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Wa sallallahu ala sayyidina Muhammadin wa ala alihi wa sahbihi wa sallam. Subhana rabbika rabbil izzati amma yasifun. Wassalamun alal mursalin. Walhamdulillahi rabbil alamin. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
It can bring blessing to all of us in this activity.
The next part is we'll take a moment to listen and sing national anthem of Indonesia Raya and continue with hymn Universitas Sumatera Utara. Ladies and gentlemen, please stand up with a proper position. Ladies and gentlemen, you're allowed to sit down.
The next agenda is welcoming speech from General Chair of Fourth Row, Dr. Fazida Aguslina Siregar, MS, PhD. Please welcome our General Chairman, Dr. Fazida. You may have is an Honorable Rector of Universitas Sumatera Utara, Dr. Murianto Amin, SOS MSc, Vice Rector, Dean of Faculty of Public Health Universitas Sumatera Utara, Profesor Dr. Randa Ida Justina MSc, Vice Dean, Distinguished Speaker, our national and international college, sponsor, all conference guests and participants.
Assalamualaikum warahmatullahi wabarakatuh. It's a great pleasure and honor to welcome all of you to the 4th Public Health International Conference, which organized by Faculty of Public Health Universitas Sumatera Utara. After the successfully of 3 PICOS events previously, this year we proudly present the 4th Public Health International Conference on September 17 and 18, 2021. Due to the pandemic situation, we hold this conference virtually. Currently, we're facing the COVID pandemic that impact on public health. As a provider of public health education in Indonesia, Faculty of Public Health Universitas Sumatera Utara take a part in this situation and dedicated to improve health program related to the public health issue. Therefore, this conference aims to share experience and new ideas regarding in managing COVID-19. This conference is a great opportunity collaboration between institutions in education, research, and innovation. Furthermore, I would like to express our great appreciation to the speaker in this conference, Dr. Arturo M. Pesigan from WHO Deputy Director, Associated Professor Supapon Sundongpua PhD from Thailand, Professor Dr. Sonu Goel from India, Professor Dr. K.M. Gabanoska from Netherlands, and Professor Chang Chuan Chang from Taiwan. We assure your thoughts, finding, and valuable experience will enrich our knowledge. I also would like to express my gratitude to all participants, authors, committee, academic partners, universities, and collaborators, especially University Kebangsaan Malaysia and University Putra Malaysia for your contribution in this conference. Ladies and gentlemen, we are pleased to note that this conference covers areas of public health such as health policy and administration, disaster management, epidemiology, biostatistics and demography, reproduction and maternal health, mental health, environmental health, occupational health, public health nutrition, and effect of COVID on public health. The total abstract presented in this conference was about 149 abstract with more than 100 participants from Indonesia and other countries around the world. On behalf of the 4th Public Health International Conference Committee, I would like to say thank you for your participation in this conference. I hope this conference is useful for all of you. I appreciate all of you and waiting for the next collaboration in research, education, and innovation in public health. Finally, I would like to say, please welcome in this conference. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Fajda, for welcoming.
This is the first time how PICO in virtual or online. It's quite challenging, but all committed do their best to organize this conference. Now we are heading to the next speech by Dean of Public Health Faculty, Universitas Sumatera Utara. Please welcome Professor Dr. Randa Ida Justina, MSE. You may have the floor.
Assalamualaikum warahmatullahi wabarakatuh. Honorable Rector of Universitas Sumatera Utara, Dr. Murianto Esos, MSI, distinguished speaker, Dr. Arturo M. Pesigan, WHO Deputy Director, Associate Professor Supapon Sutnongbua, PhD from Thailand, Professor Dr. Sonu Goel from India, Prof. Chang Chuan Chan from Taiwan, and Professor Dr. K.M. Zabanoskwa from Netherlands, and dear all participants of Public Health International Conference, PICO. Good morning, distinguished guests, ladies and gentlemen. First of all, let us say thanks to God, Allah Subhanahu wa Ta'ala, who has given blessing to us until today that we can meet virtually to attend this conference. With blessing of God, we hope this conference will running well until tomorrow. Ladies and gentlemen, I'm Professor Ida Justina, the Dean of Faculty of Public Health, Universitas Sumatera Utara. Would like to welcome you all, speakers and the participants who joined the 4th Public Health International Conference in 2021. Especially from University Kebangsaan Malaysia, University Putra Malaysia, from India, Taiwan, Netherlands, and of course, participants from Indonesia as well. As we all know, the pandemic situation affects many sectors, and we have to adapt and keep moving forward at this extraordinary situation. One of the impact is like now, we have to conduct this conference virtually. But even though virtually, I'm sure we are still excited to join this conference. I firmly believe that we will gain much knowledge and experiences because we have such a great speakers and outstanding participants. Distinguished guests, PICO, which organized by Faculty of Public Health Universitas Sumatera Utara, has been implemented since 2016. Alhamdulillah, since it was implemented until this 4th PICO, University Kebangsaan Malaysia and University Putra Malaysia always support us. Therefore, on behalf of Universitas Sumatera Utara, I would like to express my highest appreciation to the 2 universities in Malaysia, to Prof. Aniza Ismail from UKM and to Dr. Aniza Baharom from UPM. We hope that our cooperation will continue in many programs. Once again, to all honorable speakers, on behalf of Faculty of Public Health Universitas Sumatera Utara, I do thank you for taking the time to talk and share such valuable knowledge and insight in this conference. I also would like to greet all participants. I wish every one of us can take full advantage of this conference. Last but not least, I want to take this opportunity to thank all of the organizing committees and reviewers for their outstanding preparation and arrangement for this conference. May you have a meaningful and rich experiences in this conference. Thank you very much. Stay healthy and stay strong. Assalamualaikum warahmatullahi wabarakatuh. FKM USU, yes, yes, yes.
Thank you so much, Professor Dr. Anda Ida Justina MSI for the speech.
The next agenda is the remark of the opening 4th PICO. We will hear opening speech from Rector Universitas Sumatera Utara. To our Rector, Dr. Murianto Amin, SOS MSI, please welcome to deliver speech.
Assalamualaikum warahmatullahi wabarakatuh. Welcome to Universitas Sumatera Utara. Welcome to the 4th PICU, Public Health International Conference, with the theme, The Role of Public Health in Empowering Society in Managing COVID-19 Pandemic. This is the first of the international conference hosting by Faculty of Public Health, Universitas Sumatera Utara, yet the first conference conducted virtually. We are very pleased to welcome all of you, researchers, lecturers, industry, educational institutions, and other institutions. It is such an honor for us to have you all. As we all know, world is facing pandemic right now. The COVID-19 affects life in all sectors, including public health. It has devastating effects in human health. The outbreak of coronavirus disease, COVID-19, has drawn attention to the resilience of the health system and emergency preparedness and response in countries. It is good that Faculty of Public Health Universitas Sumatera Utara takes part in this situation by raise this COVID-19 pandemic issues into a theme of the 4th PICU, Public Health International Conference. Universitas Sumatera Utara is trying to make a transformation. We raise a tagline, transformation to its ultimate. To elevate our international standards in the future, USU has to become a university with international standards characterized by local wisdom. This is accordance with the objectives of this conference, to open the insights of scientists, to develop research, to provide a place for disseminating research information, facilitate interaction with scientists, academics, and practitioners worldwide, and collaborate with universities abroad. We do appreciate your enthusiasm and looking forward to another great collaborations. Last but not least, I would want to take this opportunity to thank all of the outstanding speakers and members of the organizing committees for their outstanding preparations and arrangements for this conference, as well as you, the attendees, who have made it possible. Finally, I encourage all the participants to take full advantage of this conference and expand international collaborations, both in education and research. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, sir, for the speech. This opening speech remarks that our conference is just started.
Next station is performing traditional dance. The song of traditional dance is a symbol of several ethnic groups in Provinsi Sumatera Utara. And now, please welcome Ethnic Crew Dance FKM USU. Please welcome.
pancur sisa melamering mo bagai turang ale mardida kalakmo bekel masada duan dando ale kaditapo duan dando ale kaditapo.
Wow, I'm so impressed with their performance. How about you, Iza?
Me too. I enjoyed that performance so much. It really showed how diversity in Sumatera Utara. We hope when things get better, all participants across the country can see it directly. Well, our opening ceremony is just finished. Now we are heading to the core session, the seminar session with keynote speech and continue with first plenary and second plenary. In this keynote speech, we will have moderator and keynote speech session. But before we start, let us to introduce our moderator to this session first.
All right. Yeah. She is Sri Rahayu Sanusi SKM MKS PhD. Her background education is PhD from University Malaya in 2012 and concerned on the reproductive health and women health issue. Her working experience is a lecturer at Faculty of Public Health, Postgraduate Public Health of Universitas Sumatera Utara, involved in some national project research on reproductive health in National Population and Family Planning Board of Indonesia, active in professional organization in Indonesia for Public Health, Population and Reproductive Health, IAKMI, IPADI, Persakmi, and Population Coalition of Sumatera Utara. Please welcome Sri Rahayu Sanusi, SKM MKes, PhD.
Thank you, MC, to introduce me. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. First, let me introduce myself. I'm Dr. Ayu. I will be responsible for hosting this presentation in this session. So it's honorable to be a moderator in this session today. So before we begin, I have just a few housekeeping notes. Yeah. Today's session is being live and to be available for viewing post-conference at YouTube, FKM USU official. And then, if you have any question later for the speaker, please ask directly to the speaker or use the chat feature in this Zoom webinar. Write down your name, company, and your question in the smart and to the point statement. Each speaker today will have a total of 45 minutes for their presentation and 15 minutes for discussion. And we will send you all the relevant links after the event at chat feature in this Zoom webinar. Ladies and gentlemen, since March 2020, most of the countries have facing the pandemic of COVID-19 that significance has spread widely in the world. Many strategies and policies have implemented by government of the countries in dealing with COVID-19 globally, including Indonesia. However, the spike in COVID-19 cases still increasing in Indonesia. As a community, it is essential for us to take a part to solve in this situation. All above that, the reason why we are here on a virtual platform for sharing ideas, knowledge about the situation that we are facing now. Ladies and gentlemen, we already hear our great speaker from WHO, Dr. Arturo Pesigan. Dr. Arturo Pesigan will be our first presenter, and he will share his paper title is about empowering society for readiness for future pandemics and health emergencies. Let me read the brief of the curriculum vitae of Dr. Pesigan. Dr. Arturo M. Pesigan currently has responsibility as Deputy Representative WHO Jakarta, Indonesia since 29 February 2020. Dr. Pesigan extensive experience in health coordination, partnership, emergencies, preparedness and response, community medicine, public health, planning and training, and also human resource development. Dr. Pesigan had professional practice of education, administration, and academic leadership of public health science university. And he also recipient of international award as the outstanding young person of the world in 1998 and the national prestigious award, the outstanding young man of the Philippines in 1995. Dr. Pesigan finished MSc academic in community medicine in Memorial University of Newfoundland, Canada, And he also has international publication during last few years as well. I'm glad to welcoming Dr. Pasigan. How are you?
Hello. Thank you very much, Professor Rahayu, and it's really indeed a pleasure to join and an honor to be with you in this conference. So, Honorable Rector, Vice Rector, the Dean of the Faculty of Public Health, other faculty members of the Universitas Sumatra Utara, the distinguished speakers, also for the participants, colleagues, friends. Selamat pagi. Selamat pagi, Bapak dan Ibu. It's a pleasure to be here. I have been requested to make a presentation on the topic consistently between looking into how empowering societies for readiness for future pandemics and public health and health emergencies. I would like to perhaps focus more on the aspects of communities, community resilience and readiness for emergencies. So, Madam Moderator, if I may be able to have access to share my screen for the presentation.
Yeah.
Okay. Allow me a few seconds, please. So I hope that's visible to everyone now. And I start with my presentation. Thank you very much. So, ladies and gentlemen, I would like to look into the situation of globally in terms of how it is that what we're facing right now with the COVID situation. And of course, as the World Health Organization provides some guidance and also the monitoring of the situation, I would like to just briefly present to you as to what the situation is like. So we can see here in the first two slides. The first one is on the incidence of COVID globally and to what extent it is affecting the entire world in terms of the coming up of newer cases. This slide looks into the COVID deaths per 100,000 population as of the week of the 6th to the 12th of September. And I'd like to share also with you as to the graph on the distribution of the incidents and also the deaths reported the various regions of the WHO. And at least the good thing about it, like what we're looking at present, is actually the deaths and also the number of cases that are decreasing statistics, which is of course something that will be more assuring or reassuring for all of us. So in terms of a global overview, I would like to just take note that there has been the first substantial decline in more than 2 months with the reports that we've had from the 6th to the 12th of September. And also the number of deaths decreased compared to the previous week with 62,000 new deaths. And that also the cumulative number of cases of 224 million, cumulative number of deaths of 4.6 million. Of course, we're here in Indonesia and we'd like to take a look at how the situation is. And as we can see here, we're just showing the geographic distribution of COVID-19 cases per 100,000 population in the country from the 9th to the 15th of September. And we went through a phase which is like a little disconcerting, that before you'd see a lot of the country which was really in a very dark shade color. But now we can just see that for the past week, the level has just been very, very high, with particularly with North Kalimantan, and also of concern is Bangka Belitung Islands. But please take a look that still in Sumatra, that we have areas that are still high with the confirmed cases of COVID-19. So what has WHO done in terms of public health measures and also assistance? And one of the earliest actions taken was to be able to come up with what we call the SPRP, or the Strategic Preparedness and Response Plan, starting in 2020, then in 2021, 2020. It has shifted also, and with 2021, we added another pillar, which is on vaccination. But to take a look at that, in terms of the strategic objectives of this plan, and this is like how we would want to unite and harmonize efforts through the member states of WHO in terms of how to address the problem with COVID-19. So the strategic objectives covered to suppress the transmission, reduce exposure of communities, counter misinformation and disinformation, protect the vulnerable, reduce mortality and morbidity, accelerate equitable access to new tools. Many of those are really like with a biomedical approach. And that's the thing that I would like to look into as to how we probably should shift a little bit and re-emphasize the need to look into communities. Communities, the level and the state of resilience, and also the state of readiness of our communities. And if you go to take a look, a lot of the concern has been, and as I mentioned earlier, about having a pillar on vaccination. So a lot of efforts has been like looking into how vaccination could be promoted and implemented. And of course, the aim of that is really to protect and to achieve herd immunity. We would want to fall now at this stage. We probably may not be able to achieve it yet, but at least we would have to achieve population protection or herd protection that we want to aim at. So there are various health goals for that. We look into how there would be great vaccine efficacy and also coverage. And as we've seen, it has not really been achieved in terms of the ideal situation in terms of equity distribution and access to vaccines globally. And that's why a lot of efforts are being made to further ensure vaccination will really be implemented across the world. Madam Moderator, am I okay so far, and everyone can hear me well? And the presentations here, the visuals. Okay, so may I continue then? So aside from vaccination, the other thing that we would want to promote would be to ensure that that our communities and the population, the society, would be able to observe public health and social measures. And as you can see here, it hinges a lot on how we are monitoring things at the community, what is the level of transmission. So we have the important concept of CTs, or the community transmission levels. And that means focusing on the community and what can be observed, the evidence, and what can be done. And here, the WHO has come up with some kind of a guidance in being able to adjust public health and social measures, or PHSM, what we call PHSM. So the situational level assessment combines epidemiology and public health response capacity to monitor how we're going to be responding to an emergency. It serves as some kind of a guide with this kind of color coding too. It's based on a range of indicators and qualitative assessment. And each level results in different public health control measures that would have to be put in place. And as you can see here, we look at what is the transmission level. So that would mean the epidemiologic indicators that we have. And what is the capacity, the response capacity, whether it's adequate, moderate, or limited? And that hinges a lot on the capacity at the community level. So we may have from the level of 0 until a response capacity and community level degree, or that we can describe it, which can be up to 4, which is like alarming and looking up to very high level of concern. And the public health and social measures implementation would be guided also as to the situational level that we would assess how it is like in the community. And it ranges from a situational level 0 to as high as level 4, which is red, which means concerted efforts and probably also external support that may be needed. We are far from situational level 0. And I think many of our communities here in Indonesia have even gone through a situational level 4, especially during the July and early August, when we were having a lot of cases, a lot of deaths, the lack of beds, people getting sick. So we hope that things will really go back to the situational level 0 in the future. I mean, we're on this pandemic for more than 1 year and 8, 9 months already. And we really have to be able to cope better with that. And that's where the concept of resilience comes in. So I'd like to look into what are like some of the things that we have learned from COVID-19. I'm not focusing on the epidemiologic side because I'd like to emphasize the aspect about what on our community, on the society. And these findings have been documented. Things are, of course, evolving, changing, and we're getting more evidence about things. But this is coming from the report as has been documented, the joint RCCE plan of WHO, IFRC, UNICEF, and GORN. And I'd just like to highlight some findings in that report. One is that the level of understanding in general of communities or people is influenced by a combination of socio-behavioral determinants. So that would be the age group, education, environment, and we talk to environment, the difference sometimes between urban and rural. And these are the things also that we have to take into consideration. There is also increasing evidence of decline in people's perceptions of risks. And I think that's where we have the challenge in terms of like implementing PHSM and also vaccination drives. The nice thing is that trust in scientific and factual information shared by official sources and credible institutions is often high. So, and we hope that that is maintained, that trust and the credibility of official sources and institutions are maintained. They've also said that self-reported adherence to personal measures such as hand washing, mask wearing, or keeping distance tends to be generally high. But we'll look into a caveat. I mean, it's generally high, but we'll see also other factors that have to be weighed in for people to really be practicing this. Now, adherence to measures that limit public gatherings are often poor. So, and this may be attributed to social-cultural norms, practices, traditions, and of course, as social beings, the need for social interaction. So sometimes no matter how rigid we can be in terms of enforcing regulations, we have to factor in that people may violate some of those because as observed that measures adherence to the measures when restricting public gatherings are sometimes not adhered to. Okay, then we have to look into and that's why we also emphasize a lot in the public health and social measures. Now, lower levels of knowledge decreases the level of compliance with public health and social measures with PHSMs. So the challenge there is like, how do we elevate or raise the standard or health literacy of our communities. Acceptability also of PHSMs appears to be high, with measures restricting economic activities being less accepted. And obviously, as we've seen here in Indonesia during the PPKM, when restriction of economic activities, because it has an impact to the family, to the community, then people tend also to not to adhere to the PHSM. So, and as we're going across, we're more than a year here into the pandemic, the feeling of pandemic fatigue can become a barrier to be supportive of public health and social measures. Furthermore, adoption of physical distancing is likely to be influenced by structural factors such as social and environmental context, personal circumstances. So if you're living like in an urban area, you have restricted space, of course, it's going to be very difficult to follow physical distancing. And of course, if people are very more sociable, socially like active, so it's very hard to maintain that. But then again, that's where the communication is very important. And also the engagement of the community will be very important to put across messages why we have to take such public health and social measures. There's also confusion about the meaning of different concepts. And like one concept is on isolation. And I think we have seen like what happened here also in Indonesia during the peak of the last surge, the issue about the Somali and the number of cases of people dying also because in isolation and things like that. So the measures that we take when we just define things and say isolate and things like that, but not really further supporting and describing what it should be, then we may have serious problems also in like enforcing certain measures regarding that. We go back to the concerns about the economic impact on households can be a barrier to shield most vulnerable from infection risk. They would take all the risk, even if they know they're going to be infected, if they are hard put to force economically. So we have to recognize that and we have to be able to address that particular issue. So knowledge of symptoms is crucial to trigger appropriate health-seeking behavior, but unfortunately, it does not necessarily lead to testing. That's probably why also we may have some problems with contact tracing, and people may be hesitant. And you know how it also is very difficult to get people also like the pain of getting the swabs for the nasopharynx. It can be painful and going through that motion. So you may have the knowledge, but the actual practice is they're saying it may not necessarily lead to a good rate of testing. Misinformation and rumors can negatively impact on vaccine confidence. And it's not just on vaccine confidence, but other biomedical approaches. Like we've seen how people, because of rumors and misinformation, would use this and that kind of medicine, herbal medicine, traditional medical practices, and things that do not have any scientific basis of having any impact in being able to cure or to be able to treat COVID-19. Now, the pandemic puts pressure on existing health services and makes already vulnerable groups more susceptible to preventable diseases such as measles, malaria, and cholera. So the importance of looking into what COVID has done is that it has also made our communities who are already struggling in being able to address some of the problems in the communities with outbreaks with cholera, in some areas of the country with malaria, with TB. But because of COVID, these people who are already affected are even driven to the worsening situation of such endemic diseases that are already being faced in the country, or also like of course in our neighboring countries here. Difficulties in accessing timely healthcare for non-COVID-19 health issues are influenced by structural and financial constraints and the fear of becoming infected with COVID-19 at the health facility. So a lot of surveys have shown that that people are scared also like accessing their maintenance or their preventive measures to go to their health facilities because of the fear of getting COVID within the health facility. So we have a lot of these thoughts going on in terms of individuals, in terms of our communities, serving as barriers as to how things are getting slow or public health measures cannot be implemented or to address our response to COVID-19 pandemic. So what are some of these issues that have surfaced because of the pandemic? So we would want to ask, why were we not adequately prepared for a global pandemic? And why has there been some system failure wherein we've had at the global level have a lot of measures, particularly with the International Health Regulations 2005, about the focus on outbreaks, okay? And how about also the other agreements and frameworks on like the Conference of Parties or 21 on climate change, and also the Sendai framework for disaster risk reduction. A lot of efforts have been put there, but we've seen some kind of failure in terms of us being able to have been more prepared. The other issue is that, and we've seen the things that I've mentioned earlier, when we talk about social protection, why people are hesitant in some measures because of the impact to them economically. You have to survive, you have to eat, you have to earn. So what measures have been taken to reach out to the severely affected and most vulnerable for social protection? And did we ensure? We always talk about ensuring that no one is left behind. So how have we addressed these? There's active experience that things can be done in a very nice way and an effective way, even with outbreaks and pandemics. And there have been experiences like what has happened in addressing Ebola, the Ebola outbreaks, and that you can look into and establish a stronger community-based epidemic and pandemic preparedness programs. And experience has shown, and with some of the communities that have been documented with COVID-19 response, that the community trusts greater buy-in and ownership of community-based surveillance and sustainability for improved community engagement in disease prevention has helped. And there are documentation on that. The problem is we have not really institutionalized or we have not implemented that in a larger scale. And it has shown also earlier alerting of local health authorities of possible cases of diseases are possible. And because of this, earlier action for timely control of possible outbreaks could be done. And that's what we hope to be able to do in terms of our communities, that at that level that we can have interventions and already the early warning can already start at the community level. So other things we have to take note of is that pandemic recovery, we're sort of shifting to that now because hopefully with all of the interventions that we will be moving into a recovery phase. So pandemic recovery, we have to recognize is exacerbated by climate change and ecosystem degradation. And we've seen how that has happened in other parts of the world with cyclones and also hurricanes happening. And we're very fortunate that usually August, September, there would be the dry season and also increased reports of some kind of forest fires even here in Indonesia. But so far, we've been fortunate that nothing like that has happened. But we have to be aware and conscious of these. So frequency and scale of other types of events have increased. What I've mentioned, extreme weather events are becoming the norm. The challenge now for us is not just addressing COVID, but we have to be able to manage multiple simultaneous and interconnected risks, while at the same time responding to and recovering from the pandemic. So major challenge for us. Thus, we have to learn to live with the new normal. So the pandemic has provided both opportunity and moral obligation to rethink our approaches to managing risk, and that it's required to build resilient systems and to transform our actions towards a more proactive, more collaborative, inclusive, and prevention-focused approach. And I think that's why it's very nice that that the university is really like holding this conference on public health, because we have to spread that news. And as public health practitioners, we have to work a lot on the preventive preparedness side of things. So COVID-19 has reinforced the call for multi-sectoral, multi-hazard, gender-responsive, inclusive, accessible, preventive, and anticipatory approaches. We have to consistently integrate disaster, climate ecosystems, multi-hazard risk management for strengthening resilience of people and communities to ensure sustainable development and livelihoods. And there has to be enhanced international and transboundary cooperation and consideration of cross-border and transboundary hazards, including cascading effects. And we have seen that here during COVID, the need to have multilateralism, the need to discuss issues that crosses the borders, transboundary issues across the seas, across the land with our respective countries. So what are the concepts that will have to come to the fore and that we have to re-emphasize, particularly for us in public health? So just two basic words, perhaps, 2 R's: resilience and readiness. And what I have projected here are definitions from the WHO in terms of what resilience is and readiness. So when you talk about resilience, it's the ability to prepare for, manage, absorb, adapt, and transform, and learn from public health emergencies. It's not learning just from COVID, but look back as to the big emergencies or other emergencies we've had in the past, to learn from that. And for us to be able to be agile, to manage if something would happen, and that would be basically resilience. And another important concept, readiness, it contrasts with preparedness. Okay, readiness would refer to the moment of transition between longer-term preparedness policies and actions and response to an imminent risk of or hazard, and considers the immediate actions required to respond to a developing risk or hazard. I am projecting here a photo that was taken in, I think it was shared in our epidemiologic report, or I think our operational bulletin of WHO. And this is a photo in Sri Lanka. And for me, like, the concept of resilience here is, let's say, like for the public health sector or the government, the Ministry of Health, to have the ability to think already and have measures, learning from their emergencies before, to address, example like this one, to address the surge in the number of cases for COVID that may be hospitalized. So that's the general resilience component that they had policies and the ability to address that. But we can see also when we talk about readiness, readiness is something visible. For that moment, they were already able to recognize the high risk of increase in the number of beds that would be needed for the cases. And what is your response? To be able to set up a temporary hospital to have the beds immediately. So this is a mix of the readiness that has been built to address an immediate need for COVID-19, and that has been built with a strong capacity and realization of having resilience in mind. So what we want to emphasize is that the community should be the center of pandemic preparedness and response. It's not just pandemic preparedness, so it's outbreaks and also other public health emergencies. And why is it about people in communities? Communities are definitely the first to be exposed. Okay, then they have very critical role in immediately responding and also for preventing and control. And they have the best understanding of the diversity in communities in their particular context. And as we've seen in those things that we've cited earlier, we sometimes cannot generalize some interventions, and it has been shown that the context and understanding and also implementation would differ to the national, to the regional, sub-regional, sub-national context also, so down to the community level. So the community will be the very crucial locus of interventions for any public health measures. And what we would want to emphasize here with the health emergency management, risk management continuum, and when we talk about that continuum, what others would refer to the cycle. So from prevention preparedness, of course, increased resilience, to better be for readiness, adequate response, recovery, then going back to that cycle. And within this continuum or cycle, others would describe it, we have to really to utilize and promote community-centered approaches. And these are various activities that can be done at the community level to ensure that we are stronger, more resilient, and which will make us more ready in being able to respond to any emergency. So how do we characterize that kind of approach? So there should be inclusive governance or whole of society approach in intervention. We often hear about that, but we really have to have like visible measures also on how we're going to be implementing when we talk about whole of society approach. There has to be sustainable structures and resources for innovative community-led solutions. There's inherent knowledge and inherent capacity within communities. So we have to tap into that. We have to assess, we have to analyze, and we have to look at the strengths of that community capacity to be able to respond. So partnerships, networks, and coordination, knowledge sharing platforms at all levels will have to be promoted. There are also strategies, norms, guidance, and tools for people-centered and community-led actions that are available. And there has to be like linkages with health and public health services, primary health care, and people-centered health services. So the link to the community, the link to the health facilities, tertiary medical care, and as we go along. But the strongest link has to be at the community level. So, and we've seen, and as I projected here in the slide, like we've experienced like with the Ebola outbreak in DRC and Guinea in 2021, on how they were able to use mapping risk and vulnerability assessment and scaling up of what we call operational readiness for imminent threats. So they know about the situation going on, they've done a risk assessment, so they have to scale up readiness to be able to address any imminent threat. So whether it's Ebola or COVID, the capacity will be better with readiness. And the other important aspect is that we have to work more with civil society organizations. So that would also be including NGOs and also with faith-based organizations, volunteer organizations.
Excuse me, Dr. Pasigan, you have 10 minutes left.
Yes. Yeah. Don't worry, I'll be able to finish. So, and what we've noted also in the presentation, that this is a presentation for the briefing of the member states, that of note, there are like 60 plus trusted civil service organizations in 36 countries in some documentation that we have. So that could be tapped. They can help in empowering participation and ownership of communities by investing in activities at the grassroots level. What's important is to listen and address the needs of communities, to define priority actions. And of course, when we say leave no one behind is that to have a special focus to vulnerable populations. That's for the migrants, refugees, IDPs, the ones who are with disabilities, indigenous populations, and others that have been marginalized. And this is just an example of how WHO, UNICEF, IFRC, and GORN has come up with a partnership, particularly for the risk communication and community engagement and activities that are done more in harmony and supportive of each other. And the other aspect is that there has to be coordinated approach to engage communities in public health measures that have to be taken. So what should be addressed? One would be that the role of community in risk management, the whole spectrum, prevention, preparedness, readiness, response, and recovery, has to be identified and made clear, especially to us in the public health community. In emergency system nexus, we have to ensure that where is the community involved, the people, especially in decision making. So that's with number 4. And we have to be driven by a focused vision or direction. And that has to be within the framework of the community's perspective. And to be able to achieve that, of course, is that from the very beginning, from assessment to planning, first implementation, that the community has to be engaged, has to be involved. So we say it's community-based even in decision making. And the other issue that we have to look into would be that there is an abundance of organizations, and we've seen that, especially like for us who are doing humanitarian work. In any emergency, a lot of organizations coming in with very good intentions, but we have to be more unified and more harmonized. So we have to have a way of being able to get all our stakeholders, organizations to make them work together and better. And these are attributes very ideal in terms of how we're going to be promoting community engagement. So I think this may be my last slide, and very brief. I didn't want to elaborate so much about what are the next steps, but I think even to address some of these and to describe them or further elaborate on these later would be very important. But for us to be at least conscious about what are these basic next steps that we probably should look into. So one would be, let us invest in ensuring that institutions have capacities and partnerships engaged in the community. So that would be looking at the public health institutions, national and subnational, private sector, NGOs, and civil society. But I think this is going to be very important for public health educational institutions, for the universities, because you will have a role in strengthening capacity institutions in the aspect of educating and training people in terms of promoting community resilience and readiness. Now, the second one would be, we have to ensure that to find ways of strengthening participation of communities. And that's, as we have mentioned, we have to recognize and ensure that communities are the key actors, the whole continuum for risk management in health emergencies. And the other thing that we've noted, that success of public health measures like in COVID, that it has hinged a lot on the level of health literacy of our community members. So we may insist on certain things that we want, but if the level of literacy has not been reached and we've not made efforts in doing that, we cannot be very successful. So the communities have to be engaged as promoters of health literacy. We have to relate resilience, the third point, we relate resilience at individual, household, local government, national government, organizations, regional and global levels. So the community should not be like considered as just in isolation, but all of the the promotion and capacity building for resilience and readiness should start at the individual level, then should rise at the household, then the general community, then going up until eventually we have to have a concerted effort up to the global level. And the last point perhaps would be we have to develop platforms for multi-sectoral engagement and community involvement. But these all have to be, the platforms will all have to be unified and perhaps focused. Otherwise, we can have a plethora of different approaches, but if we're not unified and that the community doesn't take an active focus, then we're again going to be lost. And again, we're going to go back to the issue of like what lessons have we learned? How have we utilized all of these international frameworks that when an emergency comes, they're all lost and we start from the beginning again. So these are just some thoughts. And I hope that it sort of like opens the eyes of more people, particularly for us in the public health field, to look into. And as staff of WHO, this is something that we're trying to build up again, and something that we would need support. And the support perhaps we could ask from you, university, our speakers, our public health practitioners in general. So before, in closing though, okay, so we go back to some public health measures, and I'd just like to re-emphasize as an ad about again reinforcing some messages. And one is like keeping distance, okay, so as part of public health social measures, wash your hands frequently, respiratory etiquette. When you talk about public health and social measures, we have to ensure that people go back to work, to school, also in our homes. But please make sure that the ventilation, air circulation is very good, so that will promote health and also suppress transmission. And of course, at this stage, we still have to wear a mask. We may be vaccinated, but we cannot know the status of others and also to prevent further transmission. So with that, I'd like to thank you. And once again, WHO recognizes your important role in promoting and strengthening public health in the country and also in the world. So thank you very much, and terima kasih.
Yeah. Thank you very much for that excellent presentation, Dr. Pasigan. Terima kasih. Yeah. From Dr. Pasigan presentation, we realized that actually we have a lot, we are facing a multidimensional variable. Then to prevent the impact of COVID-19 massively in the worldwide, we have a lot of multidimensional variable, especially on how to empowerment community and involve them. So we know that we need to involve them from the beginning until implementation and evaluation. Then we hope we can solve everything that we are facing now during the pandemic COVID-19. So now it's time for discussion. Dr. Pasigan, I would like to invite to the attendees to ask question to Dr. Pasigan. So if the attendants or you have any question, please raise your hand. So I will call you to ask the question. You can unmute your microphone. Please identify yourself, mention your name, your institution, or you can also put your question in the chat feature in the Zoom. So please, Dr. Pasigan will be ready to answer your question, I think. Because this is a quite interesting topic, Dr. Pasigan. Okay, anyone? in the column chat, we still have no question. So maybe I want to ask you something important here, Dr. President, because the pandemic situation is quite long. We are facing the pandemic. COVID-19 is quite long, and as you mentioned that most of all us already fatigue on a pandemic situation. So what do you think about this pandemic situation? How long we become this situation?
Very difficult to let's see how to say that, to do a forecast. And definitely, as WHO, our senior management officials have been saying most of the time, is that it really depends on us. The speed and also to the extent that we want to solve the problem. And we can see that many issues are also like governance issues on how to implement some of the measures. The most difficult part, perhaps, and we've seen that in many countries, is really like striking the balance between the economy and public health. And as we always say in public health, is like there is no contradiction with the public health measures and also the economic measures. But that has to be like a constant discussion and dialogue between the different sectors. And exactly that's why the communities have to be engaged, because they're the ones directly affected, and they have to be able to express that. And there has to be like a forum for them to be able to express those. And there is evidence, of course, that we've seen that following the measures are also hinged on the impact on their livelihoods, on the impact of their social mobility and things like that. So there has to be that strong cooperation and coordination between the different sectors. And we cannot possibly lose out the pandemic fatigue. Otherwise, we're going to give up, and the virus will emerge to be the winner if we let go. So we cannot be complacent. And for example, like here in Indonesia, we are at least on the nice curve that things are going down. But once complacency kicks in again, people get tired and will not move into getting vaccination. People not taking all of those public health and social measures. People at this stage going to like huge public gatherings without taking any measures. We're gonna fall back. And the virus is smarter than us to a certain extent that they can mutate. And we do not know what kind of variant we can have. But still, the technology is there with vaccines. And for example, the vaccines could have stopped and suppressed initially before the variants came. And people also could have stopped that because of physical distancing to prevent any mutation happening. But if you continue to be not conscious about these things, then we are also the ones who will be the cause of this to linger on.
All right, Dr. Pasigan. We already have one participant raise the hand. So, Risanti.
Okay. Can you hear my voice?
Yeah,
Yes.
yeah.
Okay. So thank you for the opportunity. Thank you for such useful information, useful knowledge that we have today. I have two questions actually, Dr. Pasigan. The first question is, what can we do in practice to strengthen participation of communities? Because you already mentioned about it before. And my second question is about you put some of a picture in your slide before that attract my attention. It says that let's make COVID-19 the last pandemic. Is that possible, Dr. Pesigan? Thank you.
Okay, let me answer the first question. I think for public health we have to take clearer measures, and it's not just a matter of being conscious about community participation and things like that, and having community-based approaches to health. I mean, one of the things that attracted me to go into public health when I was still a medical student is this component of community-based health programs. And I went into public health and doing that. But somehow we've become so technically or technologically driven, or too hard epidemiology driven, that we forget that other very important part. It's very hard, of course, because like there've not really been a lot of encouraging or supportive measures or programs to support that aspect on community empowerment. So with COVID, perhaps we have to revisit. And revisiting it, it's not just talking about it like with my presentation. It cannot stop there. We have to have like some institutional interventions. And I hope that's something that we can address in WHO, be more conscious about it, and have tools, have programs, have training, have a platform for all of us to get together and identify, like I said, there has to be a vision for that, and it has to be identified. And with that vision, we go into what measures we're going to take to further encourage, to measure, to see what kind of impact that we have. Because like without the impact, without the evidence, other people are not going to believe us, I guess. So we need that, and it's about time to do it. So as a public health institution, that would be very important. Now, the second question, definitely our wish is like, hopefully this is going to be the last pandemic, but we know that it will not be. Okay, so it's like a very rhetorical issue. That was the cover of the report of, I forget which, I'm not sure if it's the IHR, the review committee on its report. So I guess it's to attract the attention and to make the appeal that we have to have greater efforts to prevent future pandemics from coming. And the thing about it is that it's just a manifestation that we're caught off guard because we tend to be just like looking into big events, big emergencies that we prepare for. But we have to be prepared and make it a way of life. That's why we're saying like whole of society, then also the culture of resilience and readiness that we have to have. And that should be readiness and resilience for any kind of emergency, small or big. If we're ready for the small one, then we should be very much ready for a big emergency or from an outbreak to a pandemic. Over. Yeah, thanks.
Yeah. Thank you, Dr. Pasigan. So recently, Dr. Pasigan already answered the question. Then we also have some question here. So I will read the question to Dr. Pasigan from Ibu Eti Sudaryati. She asked about, do you think this COVID pandemic situation can be overcome by vaccination? Please, Dr. Pasigan, for the answer.
Oh, very important question. It's one of the approaches that has proven to be very strong. But as we see with any biomedical technology, and just take a look at it with medicine, it's not tied up with the public health promotion and also the socioeconomic aspects, why you have to take this medicine or why you have to be vaccinated. understanding of why the limitations also of those. It cannot be the panacea to the solution to COVID-19, and we have seen that. We have seen it to a certain extent that vaccination cannot stop at just starting. I mean, like Indonesia started it very early, right? And has promoted it. But we have seen also with the Delta variants coming in that if the vaccination hasn't caught up, and that if vaccination doesn't catch up, but at the same time we do not do the public health and social measures, then we're still going to have like a surge. And that's happened. And we've seen that here in Indonesia. We've also seen here that when you talk about vaccination, when you have limited supplies, you have to address and look into prioritization. We have seen that in some countries, and I think that's something that's being revisited with vaccination, is that we have to address the vaccination for the elderly. And unless we haven't done that, then it's going to be hard to catch up. And we all know that the elderly, the older folks are the ones that are more prone and at high risk for getting sick or even dying, which is like the target of COVID. And that's the bad result of COVID for mortality and also severity of the disease. And it cannot be just vaccination, but we have to have like the measures of increasing and strengthening the capacity of our health system to cope with any kind of pandemic. It helps, definitely. And I think that nice thing about it is like technology through vaccination has helped us to be able to address a public health crisis, but it is not the only solution to our health problems. And as public health practitioners, we know that most diseases are multifactorial, and also that there are social determinants to our health issues. So we have to approach it not just that through vaccination. And I think that's the message, because like if you talk about when you talk about probably layman and also like business industry and things like that, they perceive vaccination as the solution, and sometimes we just have blinders that is the only approach, and that's why we have to learn from our mistakes that it cannot be just vaccination alone that will address our like addressing the response to COVID-19. Over.
Yeah. Thank you, Dr. Pasgan. Because we still have 5 minutes left for discussion. So one more question, Dr. Pasgan. Yeah, this is from Usaha Satria. Good morning. Introduce, my name is Usaha Satria. I would like to ask, is there a limit to the role of public health in dealing with the COVID-19 pandemic that is currently happening in the world? Thank you. This is the question, Dr. Pasgan. Please the answer.
I might have one which to do. So the question is there a limit to the role of public health?
Yeah. The question is there any limit to the role of public health in dealing with the COVID-19 currently?
Okay. Yeah. Sorry, I find it a little difficult to answer that. We all know what the role of public health, well, as a science and also as practitioners in terms of health issues. And I think our role would be, as public health practitioners, would be really the professional practice of it, being evidence-based, looking at lessons learned, being creative and innovative in providing solutions. So when you talk about the role or the possible scope, it's very big, but we just have to be probably focused. And like for me, like having worked in health emergency management, is that we have to look at it from a health emergency management lens, like addressing the need for responding to COVID-19. Is that you can have a whole universe of interests and needs, recognize needs and demands, but we have to be focused and prioritize. And that can be only done by doing a very good risk assessment, and from the risk assessment, identifying what the priority needs are, and also providing a good strategy or solution based on the capacity that you have and the priorities that will have to be done. So the role would be really to be scientifically driven in the profession, scientifically driven. And when you say scientifically, it's not just the biomedical, but also the social sciences about it. And we also have to be bound by ethical considerations as to the actions that we'll be taking. So that things about doing no harm, looking into the issues of the vulnerable, and back to the humanitarian principle also, of course, like leaving no one behind. So the role actually can be very wide, but we have to be focused. And in an emergency, we want to see results, and we have to prioritize. Yeah. Over. Thank you.
Thank you, Dr. Fatia. Unfortunately, we already finished our time for discussion, but we still have some questions here, actually. But maybe Dr. Pasigan can answer others' question privately on private message. So for the audience, if you have additional question for the speakers, please you can ask them in the chat feature in the conference platform for this session, and speaker may answer you, or you can connect with the speaker one-on-one through a private message or meeting. Sorry, because we already finished our time for discussion now. Thank you again, Professor Pasigan, Dr. Pasigan. This is a very, very interesting topic that we are needed to share to each other to understand how we can do, how we will do in the future to solve the situation pandemic COVID-19. Thank you again. So hopefully for the participant, we can get the advantage from this presentation, and good morning. So Dr. Pasigan, if you have something to do, maybe you can still join with us also, but if you have something to do, please don't hesitate about it.
No problem. Thank you very much again.
You're welcome. All right. Now we already have, we will continue our session today. And now we already have our next speaker with us. I'm glad to welcoming Professor Sonu Goel.
Hi. Hello,
Hi.
everyone. Yeah.
Hi, Professor. So how are you?
Yeah, good.
Yeah, okay. Let me introduce you. Yeah. How is Indian weather?
Yeah, it's going on good. I think we are all learning from each other.
Okay, yeah. Our next speaker, Professor Sonu Goel, will present his paper titled Building Global Public Health Capacity of Decision Maker of 161 ITEC Nation in Managing COVID-19, Lesson Learned from IPH MDP. Yeah. I will read briefly the curriculum vitae of Professor Sonu Goel. Professor Sonu Goel is working as a professor in School of Public Health, Postgraduate Institute of Medical Education and Research, Chandigarh, India. Professor Sonu has completed research project over 40, as a principal investigator, research project sponsored by WHO, Indian Council of Medical Research, Department of Science and Technology, National Rural Health Mission, Department of Health and Family Welfare, PJIMER Research Scheme, Ford Foundation, National Health System Research Center, International Union Against Tuberculosis and Lung Disease. Another Professor Sonu Goel achievement also proven through some award within last few years through variety events and organization. And he also some his publication of some journal book as well. So Professor Sonu Goel, please welcome. The time is yours now.
Thank you very much. Thank you for a very generous introduction. I am Dr. Sonu Goel, working as Professor of Public Health in University Postgraduate Institute of Medical Education and Research, as has been introduced. And I'm also an adjunct faculty or adjunct associate professor in University of Limerick, Ireland, and also adjunct professor, honorary professor in University of Swansea, United Kingdom. So besides this, I am managing this International Public Health Management Development Program, which I will be briefing in this next 35-40 minutes, and thereafter we'll have a discussion. At the outset, I want to thank the organizers for inviting me in this 4th Public Health International Conference. And the theme of the conference is very apt. That is, what is the role of public health in building the capacity of in COVID times? So I also want to thank our alumni of IPH-MDP, Dr. Harvanshia. He was there in one of our IPH-MDP, and I will invite him towards the end to share any experience which he has in India when he was there. And I would like to also express thanks to Dr. Kritika Upadhyay, who is the course coordinator and who had been running this program along with me for last 5 years now. So the topic of my presentation will be building global public health capacity of decision makers of 161 ITEC nations in managing COVID-19. Lesson learned from IPH-MDP. The full form of IPH-MDP is International Public Health Management Development Programs. Before I start with the presentation, just give you an idea about what IPH-MDP is. This IPH-MDP was started way back in 2016 with the aim to build capacity of mid and senior level managers of 161 ITEC nations. Now, you know that we have around 193 nations in our globe. So these 161 nations excludes the nation which are developed, that is American nation, and many European regions. Except those, we have 4 continents which fall into this ITEC nations, and Indonesia is one of them. So this course was started because of the fact that everybody of you know, we are all struggling with various diseases at different point of time. This time it was COVID, and we have struggled with SARS, we have struggled with many H1N1 influenza and many other viruses or the things which come. Besides, we have very less human resource. It is not optimal. The doctors ratio, the nurses ratio are very poor. And I think in India it is poor, and I hope that many countries, including Indonesia, the same situation might be there. The human resource which are there are very poorly trained in management. They are very good in clinical skills, but they are not very good in management skills like planning, implementation, monitoring, evaluation, soft skill like motivation, leadership. So they are not very good. Conflict resolution. And these skills are really required in today's world. So what we did is we started this program way back in 2016 with India. And thereafter, this Ministry of External Affairs took this program as their flagship program. And now we are running this program. We have run 10 programs till now. And we have trained almost like 700 people from 100 nations right now. And we have many participation from Indonesia. And towards the end, if somebody want to ask question how we can participate, I will be glad to answer that question. So let us move towards how this IPHMTP has actually helped in COVID times. Can we move to the next slide, please? Right. So I think everybody of you know that we are all suffering. We are all suffering from this COVID-19 pandemic. So I will just this is the graph which you can see here that we have so many of cases which are there globally. We have around now 213 million cases, confirmed cases, and you can see that we have around 4.5 million deaths across globe. And you can see the red countries which were badly affected, which includes what we called as developed nations, includes America and other regions. And if you see the country like India is in orange. So it was also one of the countries which was badly affected by this COVID-19. And you can see Indonesia down the line. And again, Indonesia was also one of the sufferer countries where we have many COVID-19 cases. And I was keenly observing the presentation, the last presentation, how COVID-19 was managed in the country. So I think that was really encouraging. And I want to bring you the highlight that like these cases were there, and the countries which actually managed well, there was good governance in some countries. So there actually the COVID-19 has actually less effect. So we helped some countries in managing COVID-19. So let us move to the next slide, please. I think this was the very common response of various countries. I think doesn't need reiteration. Everybody, the mask was the main thing, which was the protective. So everybody weared mask. Initially, it was N95. Then there was a mask policy. At least people should wear mask because it was a respiratory route infection. So people were wearing masks. The schools, colleges, and institutions were closed. The stores were closed. People were asked to do hand washing regularly because it can transmit the infection. The crowding, the crowd and all those things were banned. And still, many countries have various restrictions. And you can see the flights and airlines and railways, everything was not operating for many months and even years. And even now, we don't have many international flights which are operating. So this was the common response. And I hope that in Indonesia also, the same response was there. Next, please. Now let us go with various challenges which people faced. You know, everybody knows that COVID-19 came very quickly. People were very less aware about that what is that virus, and people were less knowledgeable about how to manage this particular new virus. Although coronavirus was not very new, because you know all SARS, H1N1, they all fall into this coronavirus category. But this virus was new because of the fact this was specific characteristics was there, because you know every time the mutation of virus occurs, the virus becomes weakened. But here, this virus became even strong. Whenever there was a mutation, it becomes even stronger. The new strain comes, which was even more deadly. So that raises doubts about this particular virus, and people were very skeptical that how to manage this COVID-19. So the challenges remain same. The number one challenge was the untrained health force. I was telling you that people, all the healthcare staff, and I am sure that it includes Indonesia as well, that we have not very well trained health workforce which are trained in managing the things. We are very well trained in clinical skill. Everybody know very nice clinical thing, but when it comes to planning, a proper how to address a particular thing, we are not trained officially. But what is being done is, it is a knee-jerk response. Whenever something comes, some infection comes, some virus comes, we are being given that training, and that training is not sufficient. So we have untrained health workforce. Second is poor governance. That governance played a very important role in every country. The top level, prime minister, president, or those political leaders, if they are strong, if they are very well informed about, if they take very nice decisions, then these countries have very good results in terms of health. Then third is poor service delivery. The hospitals are there, but the hospitals normally are not very well managed, because either they don't have drugs or either they don't have supplies. So the service delivery, the healthcare service delivery was poor. There was poor financing to developing nations. We are always struggling with the finance, all developing nations. So we have very less finance, and we are doing much more. I can say that the developing nations are doing much more with the existing finance, existing budget, which is there in our hand. But poor financing is a problem. Availability of drugs are always a problem. And infrastructure, the health infrastructure, the public sector, people are not, in India at least, people are not very well going to the public sector, because there is a lot of rush there, and we don't find the good number of people or the doctors or nurses in there. So these were the challenges. These challenges are across the globe, especially in the developing nations. Next, please. Now, what IPHMDP did? So when this IPHMDP, or International Public Health Management Development Program, started in 2016 with our country, India. So we didn't do internationally before. We started with in India, and in May 2016, the first batch we publicized it. And you will be surprised to know that immediately after that publicization of the first batch, we received a very huge response. And at that point of time, it was self-funded. The people have to pay for the fees. And then also we received a very good response from India. We received response from almost all states, the mid-level manager who are working in or the senior level manager. So they all came, but we selected 30 to 35 people in that. And now you can see that we have trained almost 600 people from 75 countries, which are growing. Last course we have conducted, we have not included those countries. We have conducted just a few days back, but we have not included. So we have almost covered 100 countries now. And the objective were to enhance the skills and competency. If you go back to the previous slide, you can see that the management, the skills and competency were not there. So we, through this course, we want to enhance the skills and competencies of program manager who are managing various programs like TB program, malaria program, AIDS program. So all those programs require management skills, leadership skills, besides the clinical skill. And what are these skills? Team building, planning, monitoring, evaluation, project management, resource allocation, budgeting, financial reporting, total quality management, and public health communication. So these are some of the skills which we addressed for addressing these public health challenges and strengthening efficiency of organization in limited resource setting. We all understand that the courses might exist in developed nation, but when you go to a developed nation, we can't get that feel of attending that courses because you can't get the feel of your own settings. So that is why we conducted this course in a similar setting which people can go and replicate in their own country. So this was the objective of this program. Next, please. So now what happened? We were conducting the courses and suddenly this COVID-19 pandemic occurred. All these courses were physical. People, or the senior people, came to us in our organization. They stay here. And as I told, Dr. Harvanshia was here with us. And they stayed here for a few time. And then they learned in, say, 5 days. And then they go back. It was a short course, a capsular course. Then what happened was COVID-19 struck. And all the physical courses were not there. So they started the e-courses. So right now we are conducting the e-courses or the virtual courses. And another request came from the Ministry of External Affairs that can you conduct few courses for managing COVID-19 pandemic, the management of COVID-19 pandemic. And can you showcase the experiences and best practices of India? At that point of time, if you remember, in 2019, when COVID-19 came, India was in a better position. The cases happened in India, but it happened quite late. At that point of time, we managed, and our Prime Minister, Shri Modi ji, has actually curtailed the number of cases by having the quarantine when only 2 cases were there in our country. So what we did is through this course, the same thing happened to build the capacity. We conducted 3 courses, namely managing COVID-19 pandemic, experience, best practices of India. And in these courses, again, we trained mid and senior level healthcare professionals of SAARC countries, basically the South Asia countries, but also this was the focus, but we also trained many other countries from ITEC nations. And we demonstrated what are the best practices, the replicable practices in our country through short interactive e-learning modular program. So it was again an e-learning program, but it was short capsular courses where we demonstrated best practices, and target audience are the same as I told, the healthcare professionals. Next, please. These are the glimpses of the courses. You can see the report of that webinar series which we conducting, managing COVID-19 pandemic, experiences and best practices. You can see in the first course, we enrolled 84 participants from 12 countries. In the second course, we have 39 participants from 9 countries, and the third course, we have 72 participants from 4 countries. So these are the courses which we conducted for managing COVID-19. And these were the photographs of those alumni who actually attended these 3 courses. Next, please. Now I'll tell you how our courses are actually run. They are using a different pedagogy. Like, it is not always that we give presentation, but there was short presentation. Sometimes what happened, if you have a very long presentation, the participants doesn't listen much. So there were very short presentation, and which was coupled with case studies. So in India, in different states, India has 35 states, and every state is itself a big country. So there are, population wise, it is much, much higher. So we have several case studies from several states. Sometimes one state is doing good in one thing, sometimes other states are doing good in other things. So we compiled all those case studies, and that constitute the good practices of India, ranging from hospitals management to the field-based surveillance, because contact tracing and other field-based activities were also there, and also on the administrative aspect, how our administrators are actually managing. So we collected the case studies from hospital settings, from field-based settings, and from administrative settings. And then we also had panel discussions with senior policy level makers. So those people who are actually managing the things. We asked questions. We have a live discussion with the participant, and participants also asked questions with them that how you have done that, what we could do in our own country. And then we have pre and post tests to understand what they have learned and what knowledge and skills they have taken back in their country to manage the things. Next, please. So this was the profile of participants which were there. You can see we have equal, almost more male than females, although they are quite substantial number. In all age groups, participants were there. Even some participants were postgraduate and graduates. The profession they were clinicians, they were academicians, they were public health professional, and other healthcare staff. And you can see from Asia, we have around 67% participation. From Africa, we have 22% participation. We have also participation from North America, from South America, from Australia, Oceanic region. So this was the participation. And in the phase 1 and phase 2, or the course 1 and course 2, we invited people who are mid and senior level professionals. And phase 3, the third program, which was very intense. And there we called our national level senior administrator and decision makers from different 161 ITech nation. And similarly, we invited our faculty for this course. And you can see the content, what we taught them. We taught initially the orientation about COVID-19, then how to prevent infection and environmental disinfection can be done, diagnosis and clinical management of COVID-19 patient and their contacts, field surveillance and public health measures, educational and behavioral approaches, administrative and management issues, very important. Sometimes the drugs doesn't come, sometimes the supply is not there. How to manage, how to preempt, how to see that whether the supply should be on time. Various emerging issues, expert opinion and panel discussion. So this was in phase 1 and phase 2. And in the third one, we have expert opinion, and we had a very wonderful panel discussion with experts from those who are managing at country, at state level, from municipal corporation level, from microbiologists to public health physician, to medicine people, to surgical people. So all were there as a part of panel, and we discussed about things in front of all senior and mid and senior level program managers from these high-tech nations. Next, please. You can see the participant knowledge score regarding various dimensions. Whatever I told, all the modules, you can see towards the end, we have pre-test, we have post-test, and we have a significance. If you see towards the last column, there was a significant increase in the knowledge score of various dimensions of COVID-19. The significant level was less than 0.0001. So it was very, people were told that it increased our knowledge, it increased our skill in managing the program in our own country. Next, please. Now, what were the most liked elements? We also took feedback as we take in the regular courses. The most liked elements were expert panel discussion. People liked the panel discussion because they learned new things from them. The aim of the program, the case practices and facilitator were excellent because those facilitators were actually real people who are managing in the field settings. So that's why we told excellent delivery of lecture, resources and presentation. We also gave them some resources to read, the presentation we shared, and we updated the information wherever we come. So it was not always the same content. Every time the information get updated because you know that COVID-19 was one of the pandemic where there was a very quick information update. And it was very planned and very organized session. And people said that home learning and social media support was there. We had a very good social media reach. So we publicized this program in various social media and people liked that program. And another important thing were practical experience sharing and yoga session. We also conducted some yogas into it because you know that mindfulness was equally important when we need to tackle the stress. So we also conducted some laughter yoga, some traditional yoga, some meditation. We also did that. And on the left-hand side, if you see that there was various other feedback which was given by the participants. Next slide, please. You can see the green one. The green was excellent, the feedback. So these were some of the feedback statements which we asked them that I am being regularly informed about the instruction before and during program. They rated as excellent. I had a prior knowledge of what would be my takeaway from the course. Presentations were well prepared and on target. The best practices shared in this course was effective in managing COVID-19 in my country. Then the program overcame the language and other barriers and facilitated understanding. The pace and the sequencing of sessions by facilitator was excellent, which facilitated easy transfer of learning inputs. The webinar program engaged me in active learning. It was not only passive learning, it was active learning related to the goal. The course met all its stated objective, and this course was relevant in our settings. And I will be able to replicate this course and inform others to do this course for their betterment of their country. So this was some of the things, and most of the participants rated us either excellent or very good in these things. Next, please. As I was telling you that we had a very good social media outreach, and you can see from day 1 to day 5 of the course, on the left-hand side, you can see the engagements. And on the right-hand side, you can see the impressions on Facebook, Twitter, and number of posts. You can see we have around, in Twitter, you can see on the impression side, we have around 13,000 impressions, which increased from around 1,600 to 13,000 from day 5. So this was the impact because all the facilitator or participant were throughout this social media and they were posting whatever they are learning for betterment of others. So that increases the impression. People, their friends, were also learning what they are doing. And on the left side, the engagement also increased from just 170 to 1330 on Twitter, and on Facebook from 122 to 708. So you can see the how that post have actually replicated across the globe. Next, please. There was a huge social and print media response, and you can see on this that the newspapers and the print media was very excited, and they publicized this program very much. And considering the fact this is the country's program, and our country has helped other countries in managing COVID-19 pandemic. And in this process, I personally say that I also learned many things during this. When we are sharing the experiences, when I am getting the experiences from other people, from other senior level managers. Next, please. So towards the end, I want to say that this program was very helpful for increasing the knowledge and the skills of participants in managing COVID-19 pandemic. This program also improved the effectiveness and efficiency of healthcare delivery system, and also enhanced the image of country by showing the best practices of India to the global participants. So this was the entire summary of how we did this IPHMDP. Towards the end, next slide, please. So these are our future courses we are conducting. If you go to our Facebook, you just type IPHMDP or International Public Health Management Development Program. We are on Facebook, we are on Twitter. So if you join us, if you make us friends, so we always publicize new programs. As I was telling, that we just conducted one program on communication, effective communication, 5-day program. And this program is entirely free of cost because this program is sponsored by Ministry of External Affairs, which for ITEC nations, and Indonesia is one of the ITEC nations. So we conducted that program. It was very well received, and we got numerous applications from many countries. And now in October, we have another program on quality management that is on 4th to 8th October 2021. And in November, we have another 1-week program on health system strengthening. This is really important because health system, we need to strengthen our health system so that any outbreak comes, be it COVID, be it Delta strain, be it anything. So we should be able to manage that pandemic or an endemic. So we have, besides this, we are running our own programs. Our 2 programs are Ministry of External Affairs, which are offered free of cost, but we have our own portal. That is, if you Google e-learning for public health, www.elearningforpublichealth.com. So there you will find courses. We have just conducted 2 courses. One course was basic course on international public health management. So that was 3-month course, online course, and anybody who is doing his or her job can do it, because in that course we have only 1-day lecture, and thereafter we give assignment, and then towards the end we have a live discussion with the faculty. And similar thing, module 2 starts in next week, and we have a small assignment, and then we have a live discussion. And towards the end of 10 modules, we have a practicum in which the participants are attached with the faculty, and they are given a small assignment for which they have to complete in 15 days. And after the end of this 3 months, they are being awarded certificate by International Public Health Management Development Program, IPHMDP. So that was the basic course. And we are soon going to launch the advanced course on public health management. That will be the 6-month course that is under this umbrella, because normally the courses which are offered by ITEC or by Ministry of External Affairs are quite short. So they are capsule courses. We can't make participants learn about skills. We can't give them many assignments. But here in this course, we give various assignments to the participant, and this course we conduct at PGI. So we encourage you to enroll in either of these 3 courses. The top 2 courses are free courses through Ministry of External Affairs. Next, please. So I want to thank again the organizers for giving me opportunity to present the work of COVID-19 about the IPHMDP, how we build capacity of various public health professionals in managing COVID-19. And again, I thank all the participants for very keen listening on this session. And I am really happy to answer any question, any comments. If you want to join this public health management program, if you want to know about this thing, I'll be very happy to answer your queries and questions. Thank you very much.
Thank you, Professor Goel. It's kind of great presentation. Thank you for sharing us about your work there. Because Professor Goel complete his presentation before 45 minutes, so we still have plenty of time for discussion time. So I would like to invite to the attendants to ask any question to Professor Goel. So if you have any question to the Professor Goel, you must raise your hand and please turn on your microphone, or you can submit your question via chat feature in this Zoom. So please, to the attendants. Okay, while we are waiting the question from the attendants, Professor Goel, I would like to ask you something that I think is that you know the Indonesian and India get some similarity about the community, the population, or something like that. Especially during the COVID-19, we, as you mentioned before, that huge of challenge that our country is facing during the COVID-19. So I would like to ask you about what is the most challenging variable that Indian government is facing during COVID-19 now?
Yeah, so thank you very much. I think the challenges which now country is facing, because now we are almost over with the second wave of COVID-19, and we have a very stable number of cases which are not increasing right now at this point of time, because of the fact that we are adopting now. We have learned from last 2 years that what are the good things which we need to do. And because our cases, as you know, that our cases rose to almost 2 lakh per day. So at one point of time, we have around 2 lakh cases per day. So it comes to a 0.2 million per day. But right now, the cases are almost like 25,000 per day, and that are concentrated in some of the states. They are not scattered over. We are all taking precautions, and we are all having masks in the offices. Our offices are open, and for if you ask me, my office, because I am a community physician, so my office never closed even during this COVID-19 pandemic. So we went throughout the year, even during the highest rage of COVID-19 in the hospital. We were the one who actually managed the contact tracing in our region. And we were the one who were instrumental in making the vaccines, because our department here were there who actually made the vaccines for this. So all these things, I think what I urge is the vaccination is really important at this point of time. Wearing mask is important, and distancing is still important. We need to maintain that distancing. Only then we'll be able to curtail this third wave or the next wave of which people are seeing that in children it will be there, or it will be there, next wave will be there. So this is how we need to manage.
Thank you, Professor Goel. Now we already question here from Ibu Namora Lubis. Yeah, I will read the question. Good morning, Prof. I would like to ask, what is the role of mindfulness yoga in your program, please?
Well, that's a very wonderful question, Namora. And the role of mindfulness was really very helpful. And even I practiced that for some time when during this COVID-19, because we are all stressed. As I told you that since morning till evening and even at nights, we were there in offices, we are managing contacts. And when we come back home, we were always stressed that I might not spread infection to my family. So this was all stress was there when I was there in hospital and when I come back home, although we take proper precautions. But so for that, we need to do the meditation. We need to do the meditation. We need to actually do mindfulness so that the mind is stable and people don't, our mind doesn't wander about some of the bad things which are happening around. You can see that in the social media, we have various misinformation which is being scattered throughout. So we did yoga, and even many our IPHMDP colleagues, because we are in regular touch with those IPHMDP colleagues. So one of the colleagues from some country asked me that, can you do a session for us on mindfulness? So I invited few of my colleagues who are doing this technique along with some of the other relaxing technique like laughter yoga. And so these things really helped me as well as the people whom I actually delivered this technique.
Yeah. Thank you, Professor Goel. Ibu Namora also raised the hand. Maybe we can give the opportunity about this. Please, Ibu Namora.
Yeah, good morning, Prof. Sonu.
Good morning, Namora.
Your paper is very interesting, particularly about mindfulness and yoga. So you do your mindfulness every day, do you?
Yes, I try to practice mindfulness for some period of time. Although I didn't get much of time, so I do mindfulness in the morning and try to do some physical exercise in the evening.
So do you think that mental health is very important role in promoting public health?
It plays a very crucial role, because physical health sometimes are visible. We can visualize from the face or from the condition, the physical health, and we can do a lot of things for that. But for mental health, many people doesn't recognize that they need support. So that is why the mental health is really required, not only for me, for everyone. Even health promotion. People, even if healthy, should practice this mindfulness and yoga so that they remain healthy.
Thank you very much. Your answer is very important for me. And Prof. Sonu, can I register for your course about the mindfulness? I'm very interested to learn and to follow the course. And I think my dean, Professor Ida, will support me also.
Right. So we soon will be having, because we are having the capsular courses. Like right now we have 2 courses, quality management and health system strengthening. We will be soon launching the mindfulness course. And yes, so we will be having that course maybe early next year. So you keep on following us in our IPHMDP, and definitely you can enroll, and because Indonesia and India, so they are like brother and sisters, and I think we all follow almost similar, some god and goddesses are similar, and I really liked when I came to Indonesia. I traveled there for I think 3 times in Indonesia before, and it was really good to see the people there because they are almost similar to us. And definitely you follow us on IPHMDP and register us in mindfulness course, which we'll launch in early next year.
Thank you, Prof. Thank you.
Thank you very much.
Thank you, Ibu Namora, for the question.
I think Harvanshia, who was our alumni, want to speak something.
Yeah.
Dr. Harvanshia.
Professor Goel, this is another question from Dina Mariana. So I will read for you. Good morning, Prof. I am interested in IPHMDP program about short modular program and training. How effective is this program in managing COVID-19 in India, and how was the feedback of this program? Please answer.
Right. Thank you. Thank you very much for this, again, for this wonderful question. So as I told in the presentation that in iTech Nation, unfortunately, we could not train Indian participants through this course because this course was there for outside India participants, and many people like from Indonesia, from Thailand, from Guyana, from African countries. So all these people participated, and we received a good response. And as I said, that we have our cohort, we maintain our cohort. They are like our family who have actually registered in our IPHMDP. We call them alumni. We keep them giving information about our courses. And when they went back after attending this COVID-19 program, which we conducted, many people have answered that they really like this program and they are replicating it, especially some of the series, some of the components of it. And as rightly told, that mindfulness thing, so that was really important for people. Yoga thing was really important. Administrative procedures, how to manage drugs, how to preempt drugs, so they were really important. So all these things were was helpful for various participants, and I got wonderful feedback on my personal WhatsApp, on my email, and even they wrote to the Ministry of External Affairs that this was a wonderful program and we really liked, and we want to emulate this program in our own country. And there, unfortunately, the COVID-19 pandemic struck. Otherwise, there were some nations have actually invited me as a part of conducting program in their country. So iTech sponsored that, and we can also conduct similar type of programs in different countries.
Yes, thank you, Professor Goel. One of the attendants already raised the hand. So we please to Herwansa to give the question to the Professor Goel.
Thank you, Ibu Ayu. How are you?
Alhamdulillah, I'm fine.
Good. Mohon izin Ibu Ayu and Ibu Ida as a dean. Good morning, Dr. Sonu. How are you? Good.
Good morning, Arvinsha. Nice to see you after a long time.
Nice to see you again. Good morning from the Netherlands. So I'm one of the alumni of School of Public Health in this faculty in Universitas Sumatera Utara for my bachelor degree, for your information. So it's really glad to see you here to participate the international conference as an alumni of USU and Faculty of Public Health. I'm so honored, and thanks for your unconditional support for this international conference. So in the capacity as alumni of your program as well, International Public Health Management Development Program, it was such a great program, Ibu Ayu. So I was selected as the awardee sponsored by Ministry of External Affairs of the Government of India and ITEC in 2019. And I flew over from Indonesia to India and stay about 2 or 3 weeks at a time and met lots of prominent experts in public health fields from India, from other countries like in Africa, and then I think from the Europe at that time in my batch, and then also from Asia for sure. So I got lots of experience from this program, Dr. Sonu. So thanks for that. And I hope that for the upcoming course, from this session, perhaps they are interested in the program so they can take lessons learned from what you have provided. Because to be honest, you have such a great team to organize the program. From yoga, that's the most interesting part. And then field trip to Shimla. Wow, what a beautiful place to visit. Thank you for that. And then I had the opportunity as well to visit the community health center, especially supporting what I'm doing right now during my PhD program, especially regarding sustainable development goals on maternal health. It was a very helpful experience. So I can implement and apply such lessons learned that you provided for us at that time, Dr. Sonu. So for participants and also Bu Ida and also Bu Ayu or other colleagues in Faculty of Public Health, Universitas Sumatera Utara, please join the program because this is a great program, and then perhaps you can contribute something, especially during this pandemic, from the program, or perhaps from institution to institution, Dr. Sonu, perhaps Faculty of Public Health through our Dean, Ibu Ida, and other team in FKM USU can arrange sort of agreement or visit each other. We can visit India or India can visit Medan in Indonesia for further, global relationship, because it's really important right now.
Right. So thank you, Dr. Avencia, and you had been a wonderful alumni. I think we're really proud of you that how you actually fared there during the visit here, and you were actively participating in all contests. I think there were multiple contests which were there.
Yes, exactly. That's the most important and interesting part as well.
Yeah, so there
cultural things exchange.
Yes, we have cultural program as well. We have cultural program people, we were there in their dress, and the main thing was the networking. So I think we always say that we have peer-to-peer learning as well. It's not only us who teach, it is we also get taught by many participants, and participants also interact with that. So that is the beauty of that program. So I really appreciate that when people, and I really want that if we have some sort of relationship with the university, and I think I'll be happy to contribute in delivering lectures in the university or online lectures, whatever. So whatever in my capacity I can do, I'll be happy to do it.
Yeah, Ibu Ida will follow up this plan, perhaps, Ibu Ayu. And perhaps one question for Dr. Sonu from me. Dr. Sonu, during this pandemic, I know your institution has worked very hard to contribute to this pandemic preventive program especially. So could you share to us about what sort of programs or perhaps upcoming plans that you might contribute to your country's COVID-19 pandemic program? For instance, perhaps did you organize like a campaign or participating in tracing or tracking a program through your institution? So could you share to us about that? Thank you.
Yeah, thank you, Avencia. I think there were many things which as an institute we did, and not only we were actually training participants from different countries, but also we are building capacity of public health managers in the neighboring states, because they also approached us in not only doing the contact tracing or isolation and many other things, but also they were learning from that how we can improvise upon, how they can improvise. And they also came to us and we conducted some like live training on the field. So we were not there in the, that it's these type of experiences we need to do on the field level and directly demonstrate so that people can learn and they inculcate those skills rather than doing it like on the theoretical lectures. So we did that, and also we let people meet people who are doing good things so that there is an exchange of information within the participants and within good things. People were very happy. So in the sense that our institute has been trying hard, because our institute is the Institute of National Excellence in our country. So it is directly under the Act of Parliament. So that is why the eyes are on us, that we can replicate some of the things and we can give good practices and evidences to different parts of the country. So this is what we did.
Yeah, thank you, Professor Goel, and danke wel, Wawan, for the question and information. So, Dr. Sony, we still have 4 minutes left, so I will read another one question for you from Aulia Salmadina. Dear Professor Sono, I want to ask regarding.
Yes. Yeah, so I have seen the question from Aulia that she wants to know about the module 6, that is administrative and management issues. So in your opinion, what is the best approach for government to implement proper management to handle COVID-19? And if there is a country developed indicator management, do you think it's a good approach? Thank you, Dr. Aulia, for a very nice question again. You know that COVID-19, there was very interesting thing on COVID-19. It was different from routine infection, as I told earlier. So everywhere it fared differently. In different countries, it fared differently. So we can't say there is a one approach, one management or one administrative approach which fits well everywhere. So that is why we have different case studies of good management. For example, I'll just say one example. One thing which people did, like when immediately the cases came, some district immediately closed the borders. I will say, some people will say it's a good approach. They close the borders and they don't let people enter from the other states. It is good approach because people were isolated there in their own district, in their own jurisdictions. But on the other hand, some people have criticized that approach, that although the cases were less, and but there was a lot of economic loss. There was a lot of loss to, like if people want to go urgently to other states. So that was the administrative issue or the order which was given. For some of the district, it was good. For some of the district, it was not good. So I can't say that there is one approach which fits well in all the countries. So we need to learn. That is why we had almost like 30 to 40 cases. And some people liked some approach. Some people like that this approach will not work in our country. So they only took those approaches which actually they think that it will work in their respective countries. So no indicator as such. I will not say there is a guide on WHO. If you just Google, and we are writing an article on that as well, that how they have actually how prepared the countries are with respect to COVID-19. So they have done that indicator list, and we during our IPHMD programs, we always collect those figures from the top level managers and from the middle level managers about those questions. And we are about to publish that paper, that how prepared their countries were in terms of governance. Okay, but there is no fixed approach, I think, which will work everywhere.
Yeah, thank you, Professor Goel. I do believe that a lot of questions still have not answered yet, but if the attendants have additional question, maybe Professor Goel can answer into direct private message through connect to the private message. Is that okay?
I will just very quickly answer Noriani question on how to improve effectiveness and efficiency of healthcare delivery system, if you permit. Just 1 minute I will take to answer that question.
1 minute. Okay,
Just 1 minute. Yes, very quickly, because that is very important. We need to measure continuously. So there is a WHO, again, I will say there is a health system strengthening report by WHO recently released, and which have a list of indicators of measuring the effectiveness and efficiency of healthcare delivery system overall. And you have seen there is a building block, 6 building blocks of healthcare system. If you Google the 6 building blocks of healthcare system, you will find, and based on those blocks, this WHO has developed a indicator list. So you can just Google and find out that indicator list to assess the effectiveness and efficiency of healthcare delivery system.
Okay, thank you, Professor Goel. Thank you again for the interesting presentation. And now we come to the end part of the session. So thank you for the audience who already give a good response to our speaker. So hopefully this presentation give some advantage for all of us. And I'm giving back to the MC. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much.
Thank you so much, Dr. Sri Rahayu Sanusi. You have guided this keynote session successfully. And to Dr. Arturo, thank you so much for giving us the new perspective about how to empowering society for readiness, future pandemics, and health emergencies.
And also to Professor Sonugul, thank you so much for sharing ideas and perspective in building global pandemic health capacity. Finally, we reached the end of the session, plenary 1. How's your feel, Iza?
A little bit hungry actually, but don't worry. After this, we will have a break until 2 p.m. So let's charge our energy, enjoy your lunch, and see you.
Assalamualaikum warahmatullahi wabarakatuh.
Commonly called PICO, is an annual conference held by Faculty of Public Health, Universitas Sumatera Utara. PICO provides opportunities for lecturers and researchers to disseminate ideas and research results in public health. The first PICO with the theme Tropical Health and Universal Coverage was held on 1st and 2nd December 2016 at Grandika Hotel, Medan. The second PICO with the theme Public Health, Tropical, Global Environmental Change and Quality of Life was held on 26 and 27 December 2017 at GW Marriott Hotel, Medan. The third PICO, with 10 public health intervention on facing threats global health in tropical area, was held on 14 and 15 November 2018 at Grandika Hotel, Medan. Now, it's the time for the fourth PICO. Due to COVID-19 pandemic, this conference will be held virtually on 17 and 18 September 2021. This pandemic never prevented us to be productive through the research activity. Many scientists and educators from all around the world will gather and discuss about the current studies. Keynote speaker, Dr. Arturo M. Pesigan, WHO Deputy Director. And the invited speaker, Associate Professor Supapon Sutnongbua PhD. Professor Dr. Sonu Goel, Professor Dr. K.M. Zabanowska, Professor Chang Chuan Chan.
Assalamualaikum warahmatullahi wabarakatuh. Hello, I am Professor Ida Justina. I am the Dean of Faculty of Public Health, Universitas Sumatera Utara. I would like to say welcome to the 4th Public Health International Conference, PICO. This conference supports public health faculty to become an international standard faculty in developing public health science. Thank you to all those who have participated and supported the implementation of this conference. Hopefully, this conference can be useful for all parties. FKM USU? Yes, yes, yes. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. I am Dr. Fajida Aguslina Siregar, the General Chair of the 4th Public Health International Conference. It's my pleasure to welcome all of you, the participants, and all the eminent speakers from all around the world. It's an honor for us, the host of Public Health International Conference in this pandemic situation. I wish we have a great discussion with outstanding researchers from different countries around the world and sharing new and existing results related to the public health issue. On behalf of the Public Health International Conference Committee, I also would like to express my appreciation to all of you who helped us and make this event become a success. Finally, I would like to say welcome and enjoy the conference. Assalamualaikum warahmatullahi wabarakatuh.
This conference is supporting by Please welcome to the 4th Public Health International Conference. Welcome to Faculty of Public Health, Universitas Sumatera Utara. Faculty of Public Health is the 10th faculty at Universitas Sumatera Utara, based on the decree of the Minister of Education and Culture of the Republic of Indonesia, number 0376/0/1993, dated October 21st, 1993. Inaugurated by the Minister of Education and Culture on January 25, 1994.
Assalamualaikum warahmatullahi wabarakatuh. Hello, I am Professor Ida Justina, the Dean of Faculty of Public Health, Universitas Sumatera Utara. Welcome to our campus.
Assalamualaikum, I am Umi Salma, the first Vice Dean.
Assalamualaikum warahmatullahi wabarakatuh. I am Indra Cahaya, second Vice Dean.
Assalamualaikum warahmatullahi wabarakatuh. I am Eti Sudaryati, I am third Vice Dean.
Faculty of Public Health Universitas Sumatera Utara has 4 study programs currently, namely Public Health Undergraduate Study Program, Master of Public Health Study Program, Doctoral of Public Health Study Program, and 1 new study program, namely the Nutrition Study Program for undergraduate. In accordance with the strategic plan of Universitas Sumatera Utara in 2020 to 2024, namely Universitas Sumatera Utara became an international standard university characterized by local wisdom in 2020 to 2024. Therefore, Faculty of Public Health Universitas Sumatera Utara also prepared to become an international standard faculty in developing public health science in the tropical area. With the motto, "Keep moving forward," Faculty of Public Health Universitas Sumatera Utara continues to move to become one of the leading faculties. Faculty of Public Health Universitas Sumatera Utara has 5 permanent buildings with 27 classrooms. Equipped with various core laboratories that are standard for public health education, computer laboratory, and audiovisual laboratory. Faculty of Public Health Universitas Sumatera Utara also has a health center that can be used by all of Civitas Academica in Universitas Sumatera Utara to improve quality of health. The FAST Studio, auditorium, library, a comfortable prayer room, lactation corner, direct drinking water facilities that can be utilized by the academics, and also a large and neatly arranged vehicle parking lot are facilities that are available at Faculty of Public Health to support effective learning processes.
atmosphere at Faculty of Public Health Universitas Sumatera Utara is also very beautiful, with a shooting view and atmosphere with lots of greeneries because the campus environment is filled with tree plants and flowers. Besides that, Faculty of Public Health Universitas Sumatera Utara is also a non-smoking area.
Good afternoon, everyone. This is Rashna Sarfina from Public Health of University of Sumatera Utara. So today, I'm going to introduce you to our green campus. Here in our campus, we have everything that you can see, from a green grass to everything that you want to see. And also, as a part of this faculty, I'm really proud to say that I managed to get selected as an awardee for Indonesia International Student Mobility Award 2021. And I will have an experience in Glasgow University from 1 semester. So I'm really proud to become a part of University of Public Health University of Sumatera Utara. Thank you.
In the implementation of Tridharma, lecturers and students work together to achieve learning objectives and produce achievements. Students are stimulated to make invention according to the knowledge they are learning.
Hi! I'm Hadiza, part of Public Health Nutrition. I'm Fatia, part of Environmental Health. I'm Fadila, part of Public Health Nutrition. We are from private team, University of Sumatera Utara. Faculty of Public Health has a lot of missions such as excel in competition, global-minded, and to be a competitive study program. Public Health University has support of facilities in the learning process, availability of laboratories, every section support skill for colleges. We have gained support, knowledge, and insight from Public Health University of Sumatera Utara, and we are very grateful to get bronze medal in IAT International Science Fair 2021. So for all of you, come on, let's fight and be innovative colleges.
Several patents have also been produced by lecturers of Faculty of Public Health Universitas Sumatera Utara, both from research and community services.
Faculty of Public Health Universitas Sumatera Utara has 70,317 alumni already, who are currently spread across Indonesia and even abroad. They have various professions. Some become civil servants, some work in state-owned enterprises, some work as entrepreneurs, work in NGOs, even work as regional leaders.
Various domestic and international collaboration have been established and have spawned many activities that support the implementation of Tridharma of higher education. The endeavor to become faculty with international standard has been carried out since 2016. Faculty of Sumatera Utara has collaborated with University Kebangsaan Malaysia and University Putra Malaysia in carrying out various academic activities, even community services in both countries. In addition to maintaining the existing collaboration, in the future, collaboration will be expanded with other universities abroad. Faculty of Public Health Universitas Sumatera Utara has a Public Health International Conference, PICO, as a platform to share knowledges and experiences related to public health issues. By 2021, Faculty of Public Health will be holding the 4th PICO.
So, what are you waiting for? Let's come and join us here in Faculty of Public Health Universitas Sumatera Utara.
We are FKM USU. Yes, yes, yes.
Welcome to Faculty of Public Health, Universitas Sumatera Utara. Faculty of Public Health is the 10th faculty at Universitas Sumatera Utara, based on the decree of the Minister of Education and Culture of the Republic of Indonesia, number 0376/0/1993, dated October 21st, 1993. Inaugurated by the Minister of Education and Culture on January 25, 1994.
Assalamualaikum warahmatullahi wabarakatuh. Hello, I am Professor Ida Justina, the Dean of Faculty of Public Health, Universitas Sumatera Utara. Welcome to our campus.
Assalamualaikum. I am Umi Salma, the first Vice Dean.
Assalamualaikum warahmatullahi wabarakatuh. I am Indra Cahaya, second Vice Dean.
Assalamualaikum warahmatullahi wabarakatuh. I am Eti Sudaryati. I am third Vice Dean.
Faculty of Public Health Universitas Sumatera Utara has 4 study programs currently, namely Public Health Undergraduate Study Program, Master of Public Health Study Program, Doctoral of Public Health Study Program, and 1 new study program, namely the Nutrition Study Program for undergraduate. In accordance with the strategic plan of Universitas Sumatera Utara in 2020 to 2024, namely Universitas Sumatera Utara became an international standard university characterized by local wisdom in 2020 to 2024. Therefore, Faculty of Public Health Universitas Sumatera Utara also prepared to become an international standard faculty in developing public health science in the tropical area. With the motto, "Keep moving forward," Faculty of Public Health Universitas Sumatera Utara continues to move to become one of the leading faculties. Faculty of Public Health Universitas Sumatera Utara has 5 permanent buildings with 27 classrooms. Equipped with various core laboratories that are standard for public health education, computer laboratory, and audiovisual laboratory. Faculty of Public Health Universitas Sumatera Utara also has a health center that can be used by all of Civitas Academica in Universitas Sumatera Utara to improve quality of health. The FAST Studio, auditorium, library, a comfortable prayer room, lactation corner, direct drinking water facilities that can be utilized by the academics, and also a large and neatly arranged vehicle parking lot are facilities that are available at Faculty of Public Health to support effective learning processes. The atmosphere at Faculty of Public Health Universitas Sumatera Utara is also very beautiful, with a shooting view and atmosphere with lots of greeneries because the campus environment is filled with tree plants and flowers. Besides that, Faculty of Public Health Universitas Sumatera Utara is also a non-smoking area.
Good afternoon, everyone. This is Rashna Sarfina from Public Health of University of Sumatera Utara. So today, I'm going to introduce you to our green campus. Here in our campus, we have everything that you can see, from a green grass to everything that you want to see. And also, as a part of this faculty, I'm really proud to say that I managed to get selected as an awardee for Indonesia International Student Mobility Award 2021. And I will have an experience in Glasgow University from 1 semester. So I'm really proud to become a part of University of Public Health University of Sumatera Utara. Thank you.
In the implementation of Tridharma, lecturers and students work together to achieve learning objectives and produce achievements. Students are stimulated to make invention according to the knowledge they are learning.
Hi, I'm Hafizah, part of Public Health Nutrition. I'm Fatia, part of Environmental Health. I'm Fadila, part of Public Health Nutrition. We are from our team, University of Sumatera Utara. Faculty of Public Health has a lot of missions such as excel in competition, global-minded, and to be a competitive study program. Public Health University has support of facilities in the learning process, availability of laboratories, every section support skill for colleges. We have gained support, knowledge, and insight from Public Health University of Sumatera Utara, and we are very grateful to get bronze medal in Young International Science Fair 2021. So for all of you, come on, let's fight and be innovative colleges.
Several patents have also been produced by lecturers of Faculty of Public Health Universitas Sumatera Utara, both from research and community services. Faculty of Public Health Universitas Sumatera Utara has 70,317 alumni already, who are currently spread across Indonesia and even abroad. They have various professions. Some become civil servants, some work in state-owned enterprises, some work as entrepreneurs, work in NGOs, even work as regional leaders. Various domestic and international collaboration have been established and have spawned many activities that support the implementation of Tridharma of higher education. The endeavor to become faculty with international standard has been carried out since 2016. Faculty of Public Health Universitas Sumatera Utara has collaborated with University Kebangsaan Malaysia and University Putra Malaysia in carrying out various academic activities, even community services in both countries. In addition to maintaining the existing collaboration, in the future, collaboration will be expanded with other university support. Faculty of Public Health Universitas Sumatera Utara has a Public Health International Conference, PICO, as a platform to share knowledges and experiences related to public health issues. By 2021, Faculty of Public Health will be holding the 4th PICO.
So, what are you waiting for? Let's come and join us here in Faculty of Public Health Universitas Sumatera Utara.
We are FKM USU. Yes, yes, yes.
Welcome to Faculty of Public Health Universitas Sumatera Utara. Faculty of Public Health is the 10th faculty at Universitas Sumatera Utara, based on the decree of the Minister of Education and Culture. Public Health International Conference, or commonly called PICO, is an annual conference held by Faculty of Public Health Universitas Sumatera Utara. PICO provides opportunities for lecturers and researchers to disseminate ideas and research results in public health. The first PICO with the theme Tropical Health and Universal
Saatnya meraih mimpimu, arah Ramba dia ramba muda dai torio rio ramba na poso marga dia marga muda dai to uso uso na so umboto ramba dia ramba muda dai torio rio ramba na poso marga dia marga muda dai to uso uso na so umboto Allah tipang 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 polo labaya Allah rudeng 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 po Allah tipang 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 polo labaya Allah rudeng 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 po Iyang goramba namida itu parasaran niyam baroba Iyang gomarga namida itu idadatang paboa-boa Ramba dia ramba muda dari torio rio ramba ne poso marga dia marga muda dari to uso uso na so umboto Allah tipang 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 polo labaya Allah rudeng 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 po Allah tipang 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 polo labaya Allah rudeng 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 po Allah tipang 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 polo labaya Allah rudeng 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 po Allah tipang 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 polo labaya Allah rudeng 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 po
Berkibarlah bendera negeriku, berkibarlah engkau di dadaku, tunjukkanlah kepada dunia semangatmu yang panas membara. Berkibarlah bendera negeriku, berkibarlah engkau di dadaku, tunjukkanlah kepada dunia semangatmu yang panas membara. Laku ini jiwa raga ini selaraskan keangguran. Laku ini jamariku ini menuliskan karismamu. Berkibarlah bendera negeriku, berkibar di luar nuansamu, tunjukkanlah
kalu buat mandalian, mandi kalu buat mandalian, udang disangko tali-tali, udang disangko tali-tali. Mabua untuang jo para sayan, mabua untuang jo para sayan, patang disangko pagi hari, patang disangko pagi hari.
Onde, onde,
lalarui sanjo.
onde, onde,
Lalarui sanjo. Lalarui sanjo. Lalarui sanjo. Urang padang mandi kagurun, urang padang mandi kagurun, mandi basiram bungolado, mandi basiram bungolado. Hari patang matahari turun, hari patang matahari turun, dagang baurai ayam mato, dagang baurai ayam mato. Lai di timbo banda padang, lai di timbo banda padang, bilul wak juon nanta timbo, bilul wak juon nanta timbo. Lai di cubonan ba urang, lai di cubonan ba urang, nan buruak juon nanta suwo, nan buruak juon nanta suwo. Onde onde lalarui sanjo, onde onde lalarui sanjo, onde onde lalarui sanjo, onde onde lalarui sanjo, lalarui sanjo, lalarui sanjo, lalarui sanjo.
Lama sudah tidak ke ladang, tinggi rumput jadilah lalang. Lama tak ku pandang, hati telah bimbang. Lama tak ku pandang, hati telah bimbang. Layang-layang, selayang pandang, hati di dalam rasa bergoncang. Jangan ragu dan jangan bimbang, ini lagu selayang pandang. Burung layang terbang melayang, singgah sebentar di tengah kali, membuku sayang diambil orang. kurakari. Lulua itu muni berkata, melabali, tapi ading gila galau. Katau kakak ai melabali, katau ading kelau kudai. Berkata kurakari, melompat ke dalam payah. Ulam pepak kakak ngajak balik, tapi ading belum nyerilah.
The vibe of the island, well, on the island, Samoset, at the island.
Pulau Samosido, haroro aku Samosido. Ido asahu satongi ngotoku, salele ngoluku pupujiho. Ido asahu satongi ngotoku, salele ngoluku pupujiho. Disido pusoki, parteke aku hau maki. Gok disi Hasan nange menang bawang, rarat dominan didoloki. Gok disi Hasan nange menang bawang, rarat dominan didoloki. Lao pe almarhuta sara, tu sopora lele ngamulat au. Di perjalanan dan sonangan, saya tu pulau Samosin masih olau. Molo maru cuma, usengoluku saya ingat mah. Anggo baketku disita nomormu, disiude aku sari homa. Anggo baketku disita nomormu, disiude aku sari homa.
Watch it. Let's get together. Enjoy the vibrations of the island.
Lao pe almarhuta sara, tu sopora lele ngamulat au. Di perjalanan dan sonangan, saya tu pulau Samosin masih olau. Bolo masih oh, dino pur masih oh. Manangi urado hot na margota, di pulau Samosir do dapoto. Manangi urado hot na margota, di pulau Samosir do dapoto. Manangi urado hot na margota, di pulau Samosir do dapoto.
Let's my eyes down. The sound of the island, yeah. The vibe of the island, yeah. The island of Samoset. That's my eyes down. The sound of the island, yeah. The island of Samoset. Island of Samoset, you know. Ah, whoa.
Anak Medan, anak Medan, anak Medan, wow kawan. Susah didong aku soboi tak berengang. Titik jarak penghabisan air wow kawan. Asur demi kawan hidup wang-wang. Unang P51 Solo Tikotiki, siap bela kawan berpartisipasi. 378 Serta Bima Jodisi, ada harga diri mengantisipasi. Pohon pinang tumbuh sendiri. Tunggulah menantang awan. Biar kambing di kampung sendiri. Tapi banteng di perantauan. Pohon pinang tumbuh sendiri. Tunggulah menantang awan. Biar kambing di kampung sendiri. Tapi banteng di perantauan. Si batu manikam di parjoget soro manikotan dina mangingani si Bambang Karjula jula, si Bambang Karjula jula. Si batu manikam di parjoget soro manikotan dina mangingani si Bambang Karjula jula, si Bambang Karjula jula. Si batu manikam di parjoget soro manikotan dina mangingani si Bambang Karjula jula, si Bambang Karjula jula. Soro manikotan dina mangingani si Bambang Karjula jula, si Bambang Karjula jula, si Bambang Karjula jula. Pisangku belum masak, masak sabigi di hurung bari-bari. 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 Gundul-gundul pacucur Asuhan mati baho Tuakan tak sadari Otene boto Narubama parlaho Tulang songo siapa di Otene boto Lai bangku angale sumirangkan mo pancur sisada melameringis mo bagai turang ale mardida kalak mo bekel masada duan dando ale kati tapo duan dando ale kati tapo
Public Health International Conference, or commonly called PICO, is an annual conference held by Faculty of Public Health, Universitas Sumatera Utara. PICO provides opportunities for lecturers and researchers to disseminate ideas and research results in public health. The first PICO with the theme Tropical Health and Universal Coverage was held on 1st and 2nd December 2016 at Grandika Hotel, Medan. The second PICO with the theme Public Health, Tropical, Global Environmental Change and Quality of Life was held on 26 and 27 December 2017 at GW Marriott Hotel, Medan. The third PICO with 10 public health intervention on facing threats global health in tropical area was held on 14 and 15 November 2018 at Grandika Hotel, Medan. Now, it's the time for the fourth PICO. Due to COVID-19 pandemic, this conference will be held virtually on 17 and 18 September 2021. This pandemic never prevented us to be productive through the research activity. Many scientists and educators from all around the world will gather and discuss about the current studies. Keynote speaker, Dr. Arturo M. Pesigan, WHO Deputy Director. And the invited speaker, Associate Professor Supapon Sutnongbua PhD. Professor Dr. Sonu Goel, Professor Dr. K.M. Zabanowska, Professor Chang Chuan Chan.
Assalamualaikum warahmatullahi wabarakatuh. Hello, I am Professor Ida Justina. I am the Dean of Faculty of Public Health, Universitas Sumatera Utara. I would like to say welcome to the 4th Public Health International Conference, PICO. This conference supports the vision of the Public Health Faculty to become an international standard faculty in developing public health science. Thank you to all those who have participated and supported the implementation of this conference. Hopefully, this conference can be useful for all parties. FKM USU? Yes, yes, yes. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. I'm Dr. Fajida Aguslina Siregar, the General Chair of the 4th Public Health International Conference. It's my pleasure to welcome all of you, the participants, and all the eminent speakers from all around the world. It's an honor for us, the host of Public Health International Conference in this pandemic situation. I wish we have a great discussion with outstanding researchers from different countries around the world and sharing new and existing results related to the public health issue. on behalf of the Public Health International Conference Committee, I also would like to express my appreciation to all of you who helped us and make this event become a success. Finally, I would like to say welcome and enjoy the conference. Assalamualaikum warahmatullahi wabarakatuh.
This conference is supporting by Please welcome to the 4th Public Health International Conference.
Welcome to Faculty of Public Health, Universitas Sumatera Utara. Faculty of Public Health is the 10th faculty at Universitas Sumatera Utara, based on the decree of the Minister of Education and Culture of the Republic of Indonesia, number 0376/0/1993, dated October 21st, 1993. Inaugurated by the Minister of Education and Culture on January 25, 1994.
Assalamualaikum warahmatullahi wabarakatuh. Hello. I am Professor Ida Justina, the Dean of Faculty of Public Health, Universitas Sumatera Utara. Welcome to our campus.
Assalamualaikum. I am Umi Salma, the first Vice Dean.
Assalamualaikum warahmatullahi wabarakatuh. I am Indra Cahaya, second Vice Dean.
Assalamualaikum warahmatullahi wabarakatuh. I am Eti Sudaryati. I am third Vice Dean.
Faculty of Public Health Universitas Sumatera Utara has 4 study programs currently, namely Public Health Undergraduate Study Program, Master of Public Health Study Program, Doctoral of Public Health Study Program, and 1 new study program, namely the Nutrition Study Program for undergraduate. In accordance with the strategic plan of Universitas Sumatera Utara in 2020 to 2024, namely Universitas Sumatera Utara became an international standard university characterized by local wisdom in 2020 to 2024. Therefore, Faculty of Public Health Universitas Sumatera Utara also prepared to become an international standard faculty in developing public health science in the tropical area. With the motto, "Keep moving forward," Faculty of Public Health Universitas Sumatera Utara continues to move to become one of the leading faculties. Faculty of Public Health Universitas Sumatera Utara has 5 permanent buildings with 27 classrooms. various core laboratories that are standard for public health education, computer laboratory, and audiovisual laboratory. Faculty of Public Health Universitas Sumatera Utara also has a health center that can be used by all of Civitas Academica in Universitas Sumatera Utara to improve quality of health. The FAST Studio, auditorium, library, a comfortable prayer room, lactation corner, direct drinking water facilities that can be utilized by the academics, and also a large and neatly arranged vehicle parking lot are facilities that are available at Faculty of Public Health to support effective learning processes. The atmosphere at Faculty of Public Health Universitas Sumatera Utara is also very beautiful, with a shooting view and atmosphere with lots of greeneries because the campus environment is filled with tree plants and flowers. Besides that, Faculty of Public Health Universitas Sumatera Utara is also a non-smoking area.
Good afternoon, everyone. This is Rashna Sarfina from Public Health of University of Sumatera Utara. So today, I'm going to introduce you to our green campus. Here in our campus, we have everything that you can see, from a green grass to everything that you want to see. And also, as a part of this faculty, I'm really proud to say that I managed to get selected as an awardee for Indonesia International Student Mobility Award 2021. And I will have an experience in Glasgow University from 1 semester. So I'm really proud to become a part of University of Public Health University of Sumatera Utara. Thank you.
In the implementation of Tridharma, lecturers and students work together to achieve learning objectives and produce achievements. Students are stimulated to make invention according to the knowledge they are learning.
Hi! I'm Hafizah, part of Public Health Nutrition. I'm Fatia, part of Environmental Health. I'm Fadila, part of Public Health Nutrition. We are from private team, University of Sumatera Utara. Faculty of Public Health has a lot of missions such as excel in competition, global-minded, and to be a competitive striker. Public Health University has support of facilities in the learning process, availability of laboratories, every section support skill for colleges. We have gained support, knowledge, and insight from Public Health University of Sumatera Utara, and we are very grateful to get bronze medal in Young International Science Fair 2021. So for all of you, come on, let's fight and be innovative colleges.
Several patents have also been produced by lecturers of Faculty of Public Health Universitas Sumatera Utara, both from research and community services. Faculty of Public Health Universitas Sumatera Utara has 70,317 alumni already, who are currently spread across Indonesia and even abroad. They have various professions. Some become civil servants, some work in state-owned enterprises, some work as entrepreneurs, work in NGOs, even work as regional leaders. Various domestic and international collaboration have been established and have spawned many activities that support the implementation of Tridharma of higher education. The endeavor to become faculty with international standard has been carried out since 2016. Faculty of Public Health, Universitas Sumatera Utara has collaborated with University Kebangsaan Malaysia and University Putra Malaysia in carrying out various academic activities, even community services in both countries. In addition to maintaining the existing collaboration, in the future, collaboration will be expanded with other university support. Faculty of Public Health Universitas Sumatera Utara has a Public Health International Conference, PICO, as a platform to share knowledges and experiences related to public health issues. By 2021, Faculty of Public Health will be holding the 4th PICO.
So, what are you waiting for? Let's come and join us here in Faculty of Public Health Universitas Sumatera Utara.
We are FKM USU. Yes, yes, yes.
Berkibarlah bendera negeriku, berkibarlah engkau di dadaku, tunjukkanlah kepada dunia semangatmu yang panas membara. Berkibarlah bendera negeriku, berkibarlah engkau di dadaku, tunjukkanlah kepada dunia semangatmu yang panas membara. Daku ini jiwa raga ini selaraskan keanggunan. Daku ini jemariku ini menuliskan karismamu. Berkibarlah bendera negeriku, berkibar di luar nuansamu, tunjukkanlah kepada dunia ramah tamah budi bahasamu. Daku ini kepal tangan ini menunaikan kewajiban putra bangsa yang mengemban cita hidup dalam kesatuan. Mandi kalau buat mandalian, mandi kalau buat mandalian, udang disangko tali-tali, udang disangko tali-tali. Mabua untuang jo para sayan, mabua untuang jo para sayan, patang disangko pagi hari, patang disangko pagi hari.
Onde, onde,
Lalarui sanjo,
onde, onde,
lalarui sanjo, lalarui sanjo, lalarui sanjo. Urang padang mandi kagurun, urang padang mandi kagurun, mandi basiram bungolado, mandi basiram bungolado. Hari patang matahari turun, hari patang matahari turun, dagang baurai ayamato, dagang baurai ayamato. dicubonan ba urang, lagi dicubonan ba urang, nan buruak juon nan tasuo, nan buruak juon nan tasuo. Onde onde lalarui sanjo, onde onde lalarui sanjo, onde onde lalarui sanjo, onde onde lalarui sanjo, lalaruik sanjo, lalaruik sanjo, lalaruik sanjo.
Lama sudah tidak ke ladang, tinggi rumput jadilah lalang. Lama tak ku pandang, hati telah bimbang. Lama tak ku pandang, hati telah bimbang. Layang-layang, selayang pandang, hati di dalam rasa bergoncang. Jangan ragu dan jangan bimbang, ini lagu selayang pandang. Burunglah yang terbang melayang, singgah sebentar di tengah kali. Buku sayang diambil orang, balangku ada sebagai ganti. Layang-layang, selayang pandang, hati di dalam rasa bergoncang. Jangan ragu dan jangan bimbang, ini lagu selayang pandang.
Kalau tuan pergi berburu, carikan saya sikit cempelang. Kalaulah tuan asyik merindu, hatiku pula semakin bimbang.
Layang-layang bertali benang, benang ditenun menjadi kain. Kasih yang lepas jangan dikenang, samalah sama mencari lain. Layang-layang, selayang pandang, hati di dalam rasa bergoncang. Jangan ragu Samosir do Haroro aku samosir do Ido asahu satongi ngotoku salele ngoluku pupuji ho Ido asahu satongi ngotoku salele ngoluku pupuji ho Isido pusoki Parteke aku hau maki Gok disi Hasan nange menang bawang Rarat dominan didoloki Gok disi Hasan nange menang bawang Rarat dominan didoloki Lao pe almar hutasara Tu sopora lele ngamulat au Di perjalanan dan sonanga Saya tu pulau Samosir masih olau Molo maru jumpa Usengoluku saya ingat ma Anggo baketku disita nomormu Disiude aku sari homa Anggo baketku disita nomormu Disiude aku sari homa
Watch it. Let's get together. Enjoy the vibrations of the island.
Lao pe almar hutasara Tu sopora lele ngamulat au Di perjalanan dan sonanga Saya tu pulau Samosir masih olau Molo masih oh Dino pur masih oh Manangi ura dohot na margota Di pulau Samosir do dapoto
The vibe of the island, well, I'm the island, Samosir, and the island.
Pulau Samosir do Haroro aku Samosir do Ido asahu satongi ngotoku salele ngoluku pupuji ho Ido asahu satongi ngotoku salele ngoluku pupuji ho Isido pusoki Parteke aku hau maki Gok disi Hasan nange menang bawang Rarat dominan didoloki Gok disi Hasan nange menang bawang Rarat dominan didoloki Lao pe almar hutasara Tu sopora lele ngamulat au Di perjalanan dan sonanga Saya tu pulau Samosir masih olau Molo maru jumpa Usengoluku saya ingat ma Anggo baketku disita nomormu Disiude aku sari homa Anggo baketku disita nomormu Disiude aku sari homa
Watch it. Let's get together. Enjoy the vibrations of the island.
Lao pe almar hutasara Tu sopora lele ngamulat au Di perjalanan dan sonanga Saya tu pulau Samosir masih olau Molo masih oh Dino pur masih oh Manangi ura dohot na margota Di pulau Samosir do dapoto Manangi ura dohot na margota Di pulau Samosir do dapoto Manangi ura dohot na margota Di pulau Samosir do
Samoset. Oh, bless my eyes and to the sound of the island, the island of Samoset, island of Samoset, you know. Ah, whoa.
Anak Medan doa kawan, modal pergaulan boido mangoluan. Terlebih di penampilan, main cantik doa kawan, seorang manang susah happy dorian. Nang P51 solo digotiki, siap bela kawan berpartisipasi. 378 Satabi Majodisi, ada harga diri mengantisipasi. Pohon pinang tumbuh sendiri. Tumbuhlah merantang awan. Biar kambing di kampung sendiri. Tapi banteng di perantauan. Anak Medan, anak Medan, anak Medan doa kawan, susah di dongakku soboi tak berengang. Titik jarak penghabisan air doa kawan, asur demi kawan hidup luang. Nang P51 solo digotiki, siap bela kawan berpartisipasi. 378 Satabi Majodisi, ada harga diri mengantisipasi. Pohon pinang tumbuh sendiri. Tumbuhlah menantang awan.
Welcome back to the 4th Public Health International Conference Plenary Session 2. How are you people? Still excited? Now we are heading to the second plenary session.
In this session, we will have Dr. Eka Lestari Mahyuni, SKM MKes, as our moderator who will guide us to the second session. But first, I will introduce her. Dr. Eka Lestari Mahyuni, SKM MKes, is graduated from Faculty of Public Health from bachelor, master, and doctoral degree. She has been working at Training Development OSH Center USU, Secretary Epitreat Unit USU, and now working as lecturer, Faculty of Public Health, Occupational Health USU. So, ladies and gentlemen, Please welcome our moderator, Dr. Eka Lestari Mahyuni, SKM MKes. Dr. Eka, you may have the floor.
Okay, thank you, MC, for handing over this event for me to lead. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everybody. Thank you all for joining today's webinar of 4th PICO in second plenary session. I hope all of you is staying healthy, although we're still facing the pandemic of COVID until now, but it doesn't make us have to stop and still have to excited, especially to join in this conference. My name is Eka Lestari Mahyuni, and I am a lecturer at Occupational Safety and Health Department in Faculty of Public Health. And now I will be moderating this session. Of course, it's very pleasure to be your moderator in these important sessions, where we will talk about the role of public health in empowering society in managing COVID-19 pandemic. Today, we will hear together from the speakers that has coming from Taiwan, Thailand, and Netherlands in this virtual Zoom meeting. Before starting, I want to say hello to all the speakers. Hello. And participants, hello, assalamualaikum. Welcome and nice to meet you in this Public Health International Conference. And it's very gladful to meet with you, all of speakers who can attend in this conference to sharing the information that you will present later. Before presenting the material, I want to convey the material that will be presented by the speakers. Basically, this conference is very important and interesting to follow because there are a lot of information and innovation to solve the COVID-19 pandemic that will be delivered by the speakers. But all of that will be easier to understand if the all participants in here are active and discussion will run effectively. Similarly, like first plenary session, we have a few housekeeping notes in this session. First, today's session is being live and to be available for viewing post-conference at YouTube FKM USU ACID. And the second, if you have any question for the speakers, please use the chat feature in this Zoom webinar. Write down your name, company, and your question in smart and to the point statement. Third, each speaker today will have a total of 45 minutes for their presentation and 15 minutes for discussion. And the last, we will send you all the relevant links after the event at chat feature in this Zoom webinar. Great. Let me start this session with say Basmalah, Bismillahirrahmanirrahim, and deliver one of Pantun for all of you here. Go traveling to Mexico to enjoy the vacation. Welcome to the 4th PICO. Hope you'll enjoy this session. Now let's welcome to our first presenter, Professor Cheng Chuan Chan, the Dean from College of Public Health, National Taiwan University. Ni hao ma, Professor?
Yeah.
Yeah.
Thank you for your introductions. And I'm Chang Chuan Chan from National Taiwan University. It's my pleasure to share with you some of my thoughts on what public health can do during this pandemic and probably post the pandemic.
Okay, I will explain your brief personal curriculum. In here, Professor Cheng Chuan Chan is an expert in industrial hygiene and pollution control, where he get it from his education at Harvard School of Public Health. He also has professional interest in particulate matter, environmental epidemiology, exposure and risk assessment, and global health governance. He also has so many grant research activity and publication related of that. And today, he will share information about the Taiwan model of COVID-19 control and its global implication. Great. Now we respectfully welcome to Professor Cheng Chuan Chan to present the material. Please, Professor, the time is yours now.
Yes.
Yes, please.
Yeah. Okay, I'll try to share my slide first. Then, okay. Can you see?
Yes, we have seen it.
Okay. All right. Today I'm going to talk about the Taiwan models of COVID-19 control from a public health perspective. I'm now teaching at the National Taiwan University, and I'm also academic chair of a newly established Asian Pacific's hub of so-called reforms for resilience, which has been established in London, UK. And in the coming years, you probably will hear more about this. I think that's a kind of commission we established during this pandemic, and we would like to welcome more the Asia Pacific participants to be involved. You know, in this ongoing pandemic, Taiwan stands out as good examples of containing major outbreaks until now. So countries around the world are looking to Taiwan to seek the reasons why we can do it. And I will give you this success story back in 2020 that until May, you know, we make tremendous success in containing the outbreak. I can summarize in this slide. The story of this is we have a very good central command that time. I call it 4 tiers joint command centers, starting from the president and the executive end, that is our central government. And under our central government, we are Ministry of Health and Welfare, which in charge of the health issues. But the real work on infectious disease is done by Taiwan CDC, Communicable Disease Control. So the 4 layers of government work together, and they can make timely situation evaluation, decision makings, and command the executions. So it's run very smoothly to contain our outbreak. So let's go back to the timeline from December 2019 to May 2020. This is one of the chart that I can show you. So on top of that is World Health Organization's actions, you know, for the first month, as you can see from WHO's advice, you know, always advice against doing things. That's the first month of WHO advice. But in Taiwan, we have done 4 things from the beginning. One is border control. The other one is digital tracing. The third one is social distancing. And the last one is, you know, masking is social. So the 4 things we have implemented back December 31st, 2019. And you can see that Taiwan is one of the countries act very early in the beginning of the pandemic. And we made decisive decisions to start quarantines that flights from Wuhan and later Spain traveling from Wuhan. Because we learned from 2013 3, the SARS outbreak. Anything happen in China in terms of infectious diseases outbreak, even though you cannot confirm 100%, you got to be very cautious. That's why we the first place in the world to start doing this border control towards the Wuhan that time. So the success of Taiwan stories on containing this COVID-19 is we act earlier, so you can see over the 3 weeks in January 2020, we have already set up a central epidemic command centers, and based on the information we have, we upgraded week by week. And from the beginning, we don't have any medicines, only vaccines. We can only rely on non-pharmaceutical intervention measures, which are digital tracing, social distancing, and masking. So think about it. We start restricts exports of masks back in January 24th, because that masks that time were the best available controls devices we have. So we start doing this in order to have a universal masking policy we have, So this part need a lot of citizens' participation and community involvement. So I would say our citizens, our people are so much engaged in all activities of infectious control from the beginning. So move to the second month. We have more bans on a lot of travel from not just Wuhan, later the whole China, because we just don't know what situation of the pandemic occurring there. Later on, we know that the majority of cases are actually concentrated in Hubei province, and especially Wuhan cities. And but remember that WHO still advise against travel or trade restrictions, and we took a step further to ban cruise ships, right, back in February 6th, and because we have been visited by a cruise called Diamond Princess, and that cruise ships has made a lot of problem in our regions. Several countries has been affected by this. So we have to do this quick, and fortunately we contain this, and no outbreaks by interchange between our local people and visitors. And for social distancing, we made us also a wise decision to postpone our spring semesters. That allow us to have more time to reduce public gatherings, mass gathering, and reduce the context, and reduce the risk of transmissions of then still largely unknown virus that we encounter. And one thing I have to mention is we enforce a name-based mask distribution systems. During the pandemic, these kind of things can help citizens to be actively engaged in doing things that good to contain pandemic. And a very simple way of getting mask that's a channel to mobilize the citizens to do things that's good for themselves and for the society. So we practice this name-based mask distribution system, island-wise and weekly, and you can be allowed to purchase 14 masks for each persons. So people are engaged in this universal masking practice starting from February. And later on we ramp up our productions, and and also we build these mobile phones, electronic fans, back in March. So one features of Taiwan's ways of containing the pandemic is technology. So you have to use the technology and try to compete the speed of the transmission of virus. And digital technology is one thing we can do. Okay. The other one is the so-called social distancing, and I'm working for. I was a dean of the School of Public Health then, and we have weekly briefings, and we first proposed the term social distancing to our society and request for at least 1.5 meters distance and better 2 meters distance, try to reduce the close contact of people. So this also very important during the pandemic, and with academic credentials, we actually can empower our citizens with knowledge and to change their health behavior and to do good things for the societies. Okay. And later on, we encounters a very important cultural event that we have this Taoism religious event that attract probably 1 million people for a period of 2 weeks. So we use social persuasions with leaders of the religious groups and ask them to change the schedules and reduce the crowd and change the way they traditional do for this we call Maju parade, and that was also successful. Okay. Wait. So this is a reason if you look at our first half of 2021, for a very long time, almost 9 months, Taiwan ranked as per million people's confirmed case. We are very low, and from this graph, you can see Indonesia was also quite good compared to the United States. That our case numbers were low from that time, and until now, we encounters after the 2021, we start having some outbreaks. But for the year of 2020, I think many countries in Asia, including Indonesia, are doing quite well. But after May of 2020 until December, when Taiwan models was quite successful, and there's some good things and bad things I have to brief you. The good things is we have long periods without community transmissions, so the daily life of the majority of people in Taiwan are quite normal, and the reason we can keep it that way is we enforce very strict border controls, which stay until now. That means a lot of business travel, studying exchange, academic, and conferences, all this has been stopped by this strict border control. That means we don't have a lot of possibility of imported case to our society. It's good. And public cooperation is very high, for the whole years. And our masks from the rationing to surplus, so that Taiwan was engaged in health diplomacy. We have to send out our masks to over 100 countries who are in need by the mass production we have in Taiwan. I think we have contributed to many countries in controlling the COVID during the time we don't have vaccines. Okay. Well, there's always the two sides of a good policy. The other one is bad sides. Because of long periods without community, the society become presences. So we did not have enough awareness to try to plan something in advance. So, for example, we make our society has become lack of urgency to vaccinate. Okay, so that's one of the difficulty we are facing now is we did not plan early enough to buy enough vaccines for use this years. Okay, we did not plan well the strategy out of the pandemic. After so long border control, how can we be reconnected to the world, right? So these are the bad things that the later part of 2020. We saw the first major outbreak during this pandemic, starting from May this year's, and as you can see that it's right after Indonesia has a big outbreak late February this year, and we start seeing this outbreak. And what makes it happen? When the world pandemic reached like 64 million cases, and the whole world has this variants of COVID-19, including Alpha, Beta, Gamma, Delta, back in December 2020, right? There's so many happening. That means the pandemic has changed its characteristics. We are no longer during the pandemic of Wuhan. We are during the pandemic of different variants, and so the way Taiwan's models can succeed back in 2020 cannot guarantee we can have this success again. And that means the non-pharmaceutical interventions we had before could and could not be sufficient for us to handle this. So when the worst confirmed case were beyond 100 million cases in February, we have first hospital clusters and community spread back in January 12th until February 9th. Because of this, we tighten hospital visit regulations and we enforce contact tracing, all these things. And it is really very harsh that people who are sick and are treated in hospital cannot have relative visiting him or hers, So that's very, very painful to our society. But in general, our citizens still follow this strict advice. So because of this instance, plant the seed. Starting from May, we have this big outbreak we never seen before. And for daily cases, we can increase from a single digit up to like 100s, then over 500s in a very short terms. So from May until now, we are in a major outbreak that has not ended at the time I am speaking to you in these lectures. So what happened exactly? You know, the reason for that is we have very limited vaccination rate. The share of people who receive at least one dose on May 22nd is very small, insignificant numbers. And I told you, the May we got this outbreak. So low vaccination rate among our population is one of the reasons we have this difficulty of the major outbreak in Taiwan. The other one is the virus is different from Wuhan strain. So currently, the major outbreak in Taiwan is Alpha variant. So Alpha variant has more transmissible. It's more transmissible than the Wuhan strain, and so that's why we have this outbreak. So let me go through with you. You know, it's back in May 14, 15, you know, at that time, and we start seeing the cases from 16 in 3 days, reach 160. And by the end of May, we saw that almost 600 cases, and the deaths can be like a double digit that time. So that's a serious problem. So facing this, our government imposed the Level 3 pandemic alerts in May 15. Again, we act very early when we only have a double digit cases. We enforce the Level 3 epidemic alert. That means soft lockdown. Workers are encouraged to work from home, and the mobility of the people in the city reduced significantly by not going to work, not going to study, and stay home orders. So there's very fast reactions, quick reactions to this pandemic also prove a swift reactions to pandemic is very important, that we can cut down the transmission. The other one is we increase the testings. By increased testings, you can find the cases earlier and quarantine them and cut down the transmission's chance. Another big difference from the success back in 2020 is during this pandemic, it is a local government who play major roles of cut down the transmission chance. Taiwan's governmental public health infrastructures has major 3 layers. On the top, we have Ministry of Health and Welfare. It's under the executive end of the central government. And currently, we have 22 public health bureaus. For cities like New Taipei City, have like 4.5 million population, to small counties has less than like 300,000 populations, but all of them have public health bureaus. And under the public health bureaus, we have public health centers, you know. So public health centers are directly under the public health bureaus, so they are under the jurisdictions of local governments, but with professional supervisions by central government. That means our local government, 22 local governments, have direct power to dispatch all the public health manpower to fight for COVID. So that's why they can take very quick actions this time everywhere in Taiwan. For example, Changhua County Public Health Bureau, you know, this county has a population over 1.2 million in an areas over 1,000 kilometers squares. And the Public Health Bureaus has 10 divisions. They are doing medical administrations, pharmacology and substance abuse prevention, food hygiene, health promotion, disease control, laboratories, planning, information, long-term care, public health inspection, and admissions, right? So they are doing a lot of things, including disease control, that's infectious disease controls. And under that bureau, Changhua has 27 health centers. And leadership is important. Dr. Ye Yanbo, as a long-term director there, he has a medical degree and PhD in public health from our colleges. Sorry, and he specialized in infectious disease control. So during his leadership, he initiated a comprehensive screening program in the county for cancer, for non-communicable disease and infectious diseases, etc. You know. So basically, he built a very good community-based public health program, which can be ready to fight for any emergent diseases. So these programs and activities not only help develop connections and trust with the local community, but also enhance the knowledge and skills of public health workers. Both are necessary to ensure an effective public health system that can competently deliver essential public health service in time of need. Okay, so Dr. A's achievement helped him to stay as director throughout change in ruling political party in this county. You know, the county governors are democratic elected every 4 years, and his professional teams has never been changed by the change of this governorship. So that's one very important one. So for example, for Taiwan Changhua models, they use a precise screening, active surveillance. You know, that means for every identified case, Changhua will quarantine the context of the confirmed case, as well as context of context. So we have 2 layers of protections that we can make sure our control measures work. So until now, there's 0 cases for almost over 20 days already, even though we see 271 cases there. The 5-day PCR positive rate now is 0s, you know, and number of people screening is over 14,000 already. And as you can see, that for every confirmed case, we contact tracings over 3,000, you know, people. That's a big efforts for public health workers in this local government to do. And what I'm trying to tell you is the local public health manpowers and professional skills very important, and Changhua County of Taiwan can show you an examples, and cooperation between local government and academic has also been important. We have long-term cooperation with this county over 20 years. So we have several graduates working in local public health bureaus, centers. So they become a very competent workforce in the time of pandemic. That's one of the reasons that we can contain the outbreak this time so successful. So the rest of 21 local governments are not exactly the same, but they are doing a lot of things that Changhua County is doing, because Changhua model it has been copied in different counties, and they are doing quite well too. So the challenges of May 2021 is our testing numbers are not high enough. Vaccinations, the availability is a problem, and the willingness for some age group, especially the elderly ones, are still need to be encouraged. Not really the vaccine hesitancy, but we need to have more health literacy education to increase willingness for people to get vaccinated. The clusters we saw in this major break is from tea parlors, as kind of socially and culturally difficult part of our public health to do preventions. And there's stigma there too, because the society saw that places during the pandemic as so-called bad place to be. So the people from there could be stigmatized by the infectious disease that we have to overcome for this challenge. And the high population density is always a problem for infectious diseases, and hard to keep the hygiene to the standards we need. So that's the challenge. The other one is migrant workers, also was involved in this outbreak. And so that increased restrictions for letting migrant workers, more migrant workers to come in Taiwan has become more restricted. And inside Taiwan, the movement of these migrant workers also has been reduced. So this is a challenge we have to get out of this pandemic earlier, then we can go back to the more normal. So some action has been taken, the PCR test has been increased, and rapid test, home rapid test especially, has been allowed, and people are purchasing this to do their own personal care. So the theme of this conference, we are talking about empowerment. So if we have tools, let's let people to be voluntarily to be involved in pandemic control is better. So ART is one, things, but because of this data issues coming around in all the countries in Asia now, including Taiwan. So we have to increase border control again, increase the restriction again. So this is will make it more difficult for us to open up. Okay. So for example, the vaccination uptake until September 14, 2021, if you look at the Taiwan compared to Indonesia, we have higher one dose but lower fully vaccinated, that means 2 doses. Okay, so this is kind of challenges. If you look at Netherlands and United States, that's at least we have to reach 50% or 60% fully vaccinated. That was the goal. That is a goal we have to meet. But if you look at Delta now, probably we have to go as high as 90%. So it's a long way for us to go, including Taiwan and Indonesia. How can we get enough vaccines to do vaccinations in a timing way will be a big challenge for us. The factors driving the low vaccination rate is public's perception of risk benefits analysis, especially when you have low infection rate, and those people will think there's no need for vaccine in a hurry, okay? And also some side effects that we experienced when we first used AstraZeneca around February time, that when people learn about that, and there's a lot of interpretations by social media and not by the professional, not by public health academia, then it's become a bad impressions for some vaccines, right? So that's very important. Anytime when there's adverse events of vaccines, our academia has to go out very early and to interpret it in a scientific way that the audience, the general public can get the right information, okay? And geopolitical issue is also one, Asia as a whole, it cannot get secure, sufficient vaccines we need, except some countries, right? That's so we do need, and we also don't have sufficient manufacturing plants in our region to even to supply vaccines we need for many countries in these regions. And a lot of countries like Taiwan, we act too late to secure vaccines. So now the market is so tight, and we are even more difficult to get enough vaccines we need. And I would say this many countries also have shared this no urgencies syndromes of getting vaccines. That's including government and the citizens, so that's the challenge we are facing now, and we have to overcome it as soon as possible. And domestic vaccines, if we can get some, good. And Taiwan, we do have one brand, but there's trust issues because of this development path is not followed through yet. So, but we need to use this soon. So this speedy authorization has damaged the trust of the people in Taiwan on the domestic producing vaccines. Another one is testing. Look at this. Before this outbreak, the yellow lines, the yellows were the red lines I point to. We increase significant from a very low testing rate to now is about 1 per thousand. That's needed. But if you look at Indonesia's, it's still not up to 1 per thousand testing. It's not enough. But if you look at other countries like the United States, there's many times reach 5 per thousand. But if you look at most tested countries like United Kingdoms and Singapore's, we need go even higher. So testing is very important to move us back to normal for this COVID pandemic. So I think we have to increase testing, including Taiwan and Indonesia. And how to do that? We have to enforce like community-based, hospital-based testing. That's what we have done in the last 4-6 months, and we also have to implement rapid testings for people who with or without symptoms. Whenever they want to attend a mass gathering, important events, or indoors, I think this very important. So the shift in responsibility and actions from central government to global government, from the government to people, I think that's the testing policies way up ahead we have to do. The other thing that we are facing now is foreign workers in Taiwan. If you look at this migrant worker in Taiwan, end of 2019 and July 2021, in these two figures, Indonesia is a country that helped Taiwan a lot by graciously export the manpower to Taiwan to help us in two main sectors, social welfare sectors and production industries, and especially the social welfare centers that's taking care of a lot of our sick people and elderly. So that's very important to us. And but you can see after the pandemic, the numbers decrease, okay, because of the border control. So that's create a kind of anxiety and almost crisis in Taiwan, because our social welfare and production relied to some extent on the migrant workers' contribution to our economy and our society. So when there's some outbreak and there's some news talking about that migrant worker could be a source of outbreak in Taiwan, and we act very early, and we find the facts, and we kind of stop the scapegoats for some people, or especially some politicians in Taiwan, to say that migrant worker is not scapegoat for spread of COVID. That's very important. So there's a cultural things, ethical difference, always make us public health people very aware. We have to be culturally sensitive in doing our public health work. And this is just example, and especially during the pandemic, and it's happening in many countries. I just show you Taiwan is no exceptions, but we did very well to contain until now. That's as a matter of fact, this is foreign workers in Taiwan, the infection rate is not higher than our domestic one. So that's the scientific facts that can give people right information and help our public health actions. Okay. So what we have failed so far in terms of daily new confirmed case, adjust for populations, Taiwan is quite low, as you can see from this curve. We are on the bottoms. And Indonesia's used in September's, beginning of September is very high, and fortunately now is coming down quite rapidly. Is a good news. But we see the Philippines is increasing. So pandemic, if you look at this curve I show you, is still around, especially in United States, still rising. But in our regions, some are rising, some are declining. But bottom line is we are still in the COVID-19 pandemic, and there are still months, even years to go to get out of this pandemic. The deaths, we have high deaths before, then we have cut down, and and I saw that Philippines and Indonesia are still experiencing some of high deaths that left over from the infected peoples in the past few months. But we are seeing a consistent decline. It's good news. But one thing is very puzzle is so-called case fatality rate. That means number of deaths among the number of infected peoples. And in this outbreak, Taiwan has very high case fatality rate that's beyond 5%. Worldwide is about 2 to 3%, and Indonesia like close to 4% is also very high. But if you look at United States, Netherlands, there's case fatality days is lower than 2% and even lower than 1%. So that's related to our public health response and also medical care capability combined together. So this is one challenge we have to face together to find out how can we reduce these case fatality days for both Taiwan and Indonesia. So lesson learned, border control and act very, very quick as we learn the information, and we can do it well. And the Taiwan model will show you that once you have the information, and even you cannot confirm, you have to ramp up your public health measures, and you have to be ready to contain the infections as early as possible. And how to do that? The 2003 SARS outbreak in Taiwan make Taiwan spend 17 years to build that infrastructure for infectious disease control in our community, in our academics, and in our hospitals, and it pays off. It looks like this way. So this is very important ways and of containing newly emergent diseases or new outbreak. That's we are still learning during this pandemic, but some lessons has been very useful. Yeah.
Your time is has up. Maybe
okay, so I'll finish this. Okay, so for the coming months, I will stress importance of testing, and importance of implement science-based vaccination strategy, and shift from central efforts to local efforts. That's the end of my talk. I hope my talk on the Taiwan model can give you some good information that you can use and to be referenced to your local actions. Thank you for your attention.
Okay, thank you for the best presentation from Professor Chang. It's to be a good lesson to know, more the model of Taiwan that has presented by the professor in this discussion topic maybe. And of course, the COVID is still concern, and we have to very serious to secure about this pandemic. Okay, maybe from the participant, if you have a question to the professor, you can raise your hand or write down at the chat feature. Yeah. Yes. We have a question for you from Maria Siregar. And her question, she is a student from postgraduate University of Sumatra Utara. Taiwan response to the coronavirus pandemic is one of Maria, sorry. Maybe we change, yeah. The first question is from Mr. Chuang, from Tengku, from University of Sumatra Utara. She is giving a question: how to defend your community with new variants of virus with this limitation of vaccine supply? Yeah, and do you believe that the new variants can make recent vaccine effectivity not powerful anymore? And the last thing, how Taiwan going out in this outbreak situation become an endemic, or perhaps your society are ready for living a life with this disease together? Maybe that is the first question, and we will continue with Maria. Sorry, Maria, you have waiting for this.
Okay, just quick response. Yes, we cannot defend without a fully vaccinated population. So that right now, the whole society is trying to get sufficient vaccines from all possible places and to vaccinate our population as soon as possible. So at least we will reach 60%. That's the government said, but academia like to go over like 70% by the end of years. So this is the only way. And the variants, we believe, will become more contagious in the coming months if there's new ones coming. So we, public health has always to take a precautionary principle. That's to plan ahead of the time. I think that's the way. But we still very comfortable with people work together jointly. We can, defend ourselves against our common enemy, that's the virus, right? So we, public health professional, has to give people the hope that we can always try our best to defend every one of them, and that's but with the knowledge we have, with all the tool we have, that's I think kind of things I would like to share with you. Yeah. Okay. How about the next questions?
Okay. Thank you. Maybe Tengku Mossadegh can receive the answer, yeah. And we continue with the second question from Maria Siregar. He need to know information about how is Taiwan paying attention to the mental health of patients who have recovered from COVID-19, and what is the role of health worker in that to handle that? Because we know that the mental health is an important issue that must be considered. Maybe this about the mental health, sir, please.
Yeah, from the beginning, we saw that even from the isolations, peoples who are quarantined for 14 years, and also those who are infected, and we have to have supporting systems to do that. So there's hotlines of supporting phone call that everyone can reach out to this, both government run and also NGOs running this, to have the mental health support. And more important than that is our health professionals, right? They are under such a stressful working environments for over 1 year now, over time, all of this. And so the hospitals has some of supporting system for them, but I would say it's not enough. That's it has the pandemic has dragged so long, so this kind of fatigue for our health workers and all the public health professionals in this has gone through very difficult. And I agree, this is a main part of public health we are facing now. On top of that, a lot of parents, during this pandemic, there's work from home, and there's children are put in the home. All these mental health issues would be arising, and not to mention for those confirmed cases. There's a long COVID, so people who has been infected COVID could possibly never recover to the full functions of their health. So those kind of things that we have to worry about that. But for now, the first priority is still to contain the pandemics first. But don't forget that our public health is looking as health as a whole, and mental health is usually the one part has been overlooked, and we have to advocate. We have to look at these health problems, not easily to be seen, but very important. Very good questions. Yes.
Okay, thank you, Professor. So the important thing is about the health, yeah? Don't forget about your health. Okay, next question for you, Professor, from Natasha Siahaan. He needs to know about how big is the role of health promotion media in overcoming the COVID-19 pandemic in Taiwan, and how is the government handle with the hoax news related to the spread of COVID-19? Maybe you can answer this directly, sir.
So at the beginning, that Taiwan CDC and together with Executive M, and I was one of person as expert invited by them, and decided to make health education for the community through the televisions. So every 30 minutes in Taiwan, you will see health communication message, broadcast by doctors, nurses, opinion leaders in Taiwan. So no matter what program you are watching, what channels, you always get this most updated informations. Yes. The other one is this the most difficult misinformations of COVID. So government has a branch, searching all these misinformations every real time, and they will give this misinformation to experts. So for me, I got consultation a couple of times and try to verify whether such information is correct. And I will give them some professional advice. Once this information has been verified false, and the government will send out from the social medias and to counteract. And also in the next day, some of the newspapers will publish this in yesterday, such and such false information about COVID. So this is the two ways we are doing this. But frankly speaking, it's very difficult. That's misinformation. Once it's out, and it has already affected a lot of people. So this is actually an area our public health schools has to start spending more research on this. How can we come back with this misinformation of health informations in a real time, in an effective way? And I can only offer you some of Taiwanese way of dealing this, but frankly, it's not as success as I like to see. Yeah. Okay. Any other questions?
Okay. Of course. Thank you, Professor. But we have still question, but the time is up. Yeah. So I'm so sorry for Olivia and that had raised their hands, and the next question about the digital tracing. But because the time, maybe we can hold it and change to and continue to the second presenter or the second speaker. But very grateful about the question, and thank you for Professor Chang Chuan Chang. Maybe we can continue this session, yeah. And now we continue.
Okay, thank you very much. Yeah.
Yes, you're welcome, Professor. And now we continue to the second presenter, the pretty young lady from Naresuan University, Faculty of Public Health, Thailand. Welcome to Associate Professor Supapon Sunongbua, PhD. Sawadee ma'am.
Sawadee ka.
Okay, I'm so sorry if we are late to starting for you. And
okay.
We can see, okay, thank you. We can see her curriculum vitae in the screen. She is a lecturer at Faculty of Public Health, Naresuan University, Thailand, and passed her Doctor of Philosophy in Health Science since 2011. She is expert in elderly health, community health, qualitative research with thematic analysis and mixed method. Also expert in quality of life and minorities health. She has current research article in 22 articles and have 3 textbooks as publication. Wait. She also a reviewer and editorial board of international journal that indexing by PubMed, Medline, and Scopus. Wow, this is a wonderful information, and maybe for students and lecturers, we can collaborate in academic improvement in research or others. Then today, she will talk about the role of policy in preventing transmission of COVID-19. So to shorten the time, let's welcome Ms. Supapon to present in this conference. The Zoom platform now is yours, please.
สวัสดีค่ะ Selamat siang. Selamat siang.
Selamat siang.
Today, I'm going to discuss or talk or share the experience of Thailand in terms of COVID-19 outbreak. Okay, we are going to go to the first slide of the role of policy in preventing transmission of COVID-19. For this, as everyone knows about coronavirus disease, the characteristic of coronavirus, the protein cover all around coronavirus is like this. Everyone knew. First, in the morning, I listened to the news about coronavirus. Now, somebody may know about Nipah. Do you know Nipah? Nipah virus is the variant virus that happened recently. Nipah virus are from bat. A bat. The bat bite fruits and blood from pig. The people who eat pig, who eat the fruit that is bitten by bats, can cause Nipah. Nipah is the name of the newest virus in the world at the moment. And some researchers believe that Nipah can cause COVID-19. Nipah virus is the variant virus that can cause, may cause COVID-19. Some researchers believe that. At the moment, they found that Nipah virus is very dangerous virus in the world. It's happened in Malaysia in 19 something, and then Singapore, and then Malaysia, Singapore, and India. Eventually, at the moment, it's happened in India. And Nipah is the name of the city in Malaysia. The first time of Nipah virus happened in Malaysia. So everyone should know that bat is a cause of any virus. Yeah, can cause any viruses. As I have experience of research about a bat. At that time, I was the researcher of USA. Then we discover about the cause of the disease that can contact a bat, that can cause from the bat at that time. So from now on, we should be aware of the source of virus. In terms of situations of COVID-19 pandemic, as many countries have been threatened by coronavirus in 2019. So we call COVID-19. And the government policy in every country has been launched in preventing transmission of COVID-19. Then, two major ways to prevent the COVID-19. The first way is to prevent the cause of the disease. And the second way is to prevent the transmission. So, two major ways. Then we will go to as the major way, the two major ways I told can set up to be the policy to protect and to treat the people who get the COVID. So I would like to tell you guys about the COVID-19 situations in Thailand. So I will go to the link. Can everyone see the link? Okay, here it is. This is a Thailand situation of COVID-19. It's reported on 17 September, today, today at 2 o'clock p.m. So total 1 million, around 1 million people have got COVID-19. See. Then new cases, around 14,000, and serious 3,000, and this one is the total, yeah. And 15 people are dead. See, at this report, for the report today. So, and then we report about the traveler screening at the port of entry as well. So as you can see that the COVID-19 is very, we can contact COVID-19 easily. As the WHO reported, the COVID-19 can be airborne disease at the moment. So we will go back to my slide. So the Thai government tried to set up the roles of the policy, in preventing transmission of COVID-19. The major role for preventing COVID-19 is the role of Ministry of Health. According to the Ministry of Health task, they distribute the task for healthcare workers. And the second one is health volunteers. And the other one is other volunteers happen in Thailand. It's happened because of healthcare provider shortage. That's why other volunteer happens. The people who are willing to help others, that from dying from COVID-19 or people who are sick from COVID-19, the other volunteers help them. For the health, they help to transfer the patients from home to hospital, and they transfer the people who die from COVID-19 from home to the temple. They help to transfer the Thai health medicine to the people who get COVID-19 at home, transfer Thai herb medicine to treat them at home. These tasks are the tasks of other volunteers. See, in the crisis, healthcare provider shortage, we have not enough healthcare provider at the moment. So that is the reason why other volunteers happen to healthcare provider. So this means that the government should consider about the production of healthcare provider in the country, because at the moment we have not enough healthcare providers compared to the patient who get COVID-19. So the impact on vulnerable people. Come back to the impact of vulnerable people. As I told you, healthcare provider shortage. So we have not enough healthcare provider because the COVID-19 spread in all people, including vulnerable people. The impact of such pandemic has been exacerbated in all people, including vulnerable people, such as homeless people, minority peoples, elderly people, and children, even children, including the migrant from our neighbors, such as Myanmar, migrant from Myanmar, migrant from Cambodia, migrant from Laos. So the government tried to solve that problem because the exacerbate is very serious. The policy in Thailand. The policy in Thailand is divided into two strategies. First strategy is proactive strategy, and the second is passive strategy. In terms of proactive strategy, surveillance has been employed among people who are at risk, of infection, in order to seek people who get infected COVID-19 and separate them from others. The rapid test has been used by people themselves as a result of healthcare provider shortage in this crisis. The risk people are provided antigen test kit, so we call ATK, by the government for free. Yeah. And work from home on online study happened. Lockdown zone in some area, especially in the dangerous area or dangerous province in Thailand. The government divide or separate the province in Thailand is they divide in category: the red zone, yellow zone, and pink zone and white zone. So if the lockdown zone in the red zone, because the red zone is there are a lot of infected people in the red zone, so we lock down the red zone. And state quarantine for the people who move from the red zone to other zone, they need to do the state quarantine. and the government set up the Phuket Sandbox. Phuket province is the special place in Thailand because a lot of foreigners wants to travel in Phuket. Many people know well about Phuket. It's the popular place, right? And the sand is very clear and the bridge is very nice and beautiful. So the government knew about the place. We want to prevent COVID-19 and we need income as well. So that is the reason why we set up Phuket Sandbox to be the model from other provinces. So just try the Phuket Sandbox to be the pilot project. The people who want to, the people who live in Phuket need to be vaccinated at least 2 doses. So every people in Phuket need to be vaccinated for 2 doses of vaccine. And the people who want to go to Phuket need to be vaccinated at least 2 doses of vaccine as well. So it's like sandbox. You can imagine that. The box, put the sand in, just limitation this area. And the Thai government allow foreigner to come to Thailand, but they need to do the state quarantine in Phuket only. It means that they need to confine themselves in Phuket only. It seems that they can travel and can do the state quarantine at the same time in Phuket. But before coming to Thailand, they need to be vaccinated. I mean the foreigners. Yeah, so we call Phuket Sandbox. And at the moment, Phuket Sandbox is the model. And now the government set up Pattaya to be the Pattaya Sandbox as well. Pattaya and can be Chiang Mai, can be just the travel zone in Thailand will be like the Phuket Sandbox. Okay. That is my slide. Moment. Now, and also the government set up the policy in Thailand that all people in Thailand need to follow. We call DMHTT. DMHTT means D, distancing, M, mask wearing, H, hand washing, T, testing COVID-19, and another T is Thai China mobile application for surveillance. So every Thai person need to download Thai China application. Even me, I need to download. I have Thai China application as well because every people need to be vaccinated. They need to download Thai China in order to register Thai China and Mo Chana. We need to register our name and ID card and ID number in Mo Chana or Thai China in order to identify that I got vaccine, in order to identify that okay, where I am or where I am. So they can they will know and they will follow where I am in somewhere in order to know that the people who got or the people who got COVID-19, they want to know or find out the people who got COVID-19 live in. We will know where they are, something like that. So this kind of the MHTT policy is, I think it's work in Thailand because we are encouraged to download this application from the Thai government, because after downloading, we can get a lot of welfare. We can get some welfare as well, especially the vaccine. For the MHTT policy is like this. So now we will go to vaccination situation in Thailand at the moment. I just get this data from the news in the morning, and then I add in my news slide in order to tell you guys about the situation that is very update. Yeah, I just got this information in the morning. From overall 100 million doses, it's the target of vaccination in Thailand. Now we have 48% of Thais were vaccinated. 48% of Thais were vaccinated, and 52% of Thais are going to be vaccinated. Of those 48%, Thais were vaccinated. 35.35% got one dose of vaccine, and 11.75% got 2 doses, and 0.89% got 3 doses of vaccine COVID-19. The people who got 3 doses are healthcare provider, yeah, at the moment. And then in the 1st of October, Thai people who are 12 to 18 years old will be vaccinated. The people who have been vaccinated 2 doses are allowed to travel across provinces in the country. Yeah. For me, I just got one dose of vaccine. Next month, I will get a 2nd dose of vaccine. Thai Health study for alternative COVID-19 treatment happened. Actually, the people, I mean Thai people, we use Thai herb, this kind of Thai herb, we use this for a long time, but we don't know that it can improve the patient conditions and relieve symptoms without major side effect from COVID-19. We don't know, but our ancestors used this kind of herb for a long time, and now some people try to use this kind of herb when they got COVID-19, and then they feel better. Yeah. Then the government encouraged Thai people to take the Thai government by the FDA of Thailand allow people to use this, because the side effect is just a little bit. The condition, the indication to use this kind of herb, we will take this kind of medicine when we get COVID-19 only, not for protection, but for treatment only. And FDA of Thailand allow Thai people to take it when they get COVID-19. So we call ฟ้าทลายโจร and in the chemical name is Andrographis paniculata. It's really hard to pronounce. It's chemical, but it's hard to say in biology name. I think biology name, but Thai people know ฟ้าทลายโจร is easy word. ฟ้าทลายโจร and we plant a lot of ฟ้าทลายโจร. We can say it around Thailand. In every places in Thailand, you can plant it, but we don't know. In the past, we never know, and now we know. In the past, we never knew, but now we knew. Then a lot of people, a lot of houses, people in the house and people in many areas plant this in every family. Almost every family in Thailand try to plant it. If they get sick, in the past, our ancestor, when they got high fever, just eat the leaf of this kind of ฟ้าทลายโจร and chew it and then swallow. After that 1 or 2 hours, the fever has disappeared. And the pharmacologist try to research about this kind of herb, and the researcher found that it can treat the fever. It can treat some virus, and then the people who got COVID-19, they took it around 2 capsules per day. They feel better and better. That is the reason why the government encourage people to use it, and FDA allow Thai people to have it, to use it. So now it's popular in Thailand. But in the past, nobody knew that it can treat COVID-19. Nobody knew. Just it's like herb. It's like general herb. Everybody ignore. But now everybody is interested in this kind of herb. Also, the orange peel extract can be the vaccine in the near future. It's discovered by the researcher at Chulalongkorn University. Chulalongkorn University is the top university in Thailand. Because this university is the government university, and they got a lot of funding for doing some research. And rutin, they found that rutin is the thing that they extract from orange peel can kill the COVID-19 virus. At the moment, it's in the research process. In the trial. So tobacco leaf extract can be the vaccine for COVID-19 as well. Now it is in the trial process, by the researcher at Chulalongkorn University as well. So you can find out more detail in this link. So I will send the link in the chat channel in here, and you can search and read some detail. Yeah, so we call this kind of tobacco leaf, Thai people call tobacco leaf as baya. Baya means tobacco leaf. Yeah, we extract for the vaccine. Yeah. The thing I told you is proactive strategy. So now we are coming to passive strategy. For the passive strategy, temporary hospitals or field hospitals have been established for providing primary care to infected people who have been severe. Because at that moment, in the crisis, the beds in the hospital is not enough for infected people. So they screen the people. The people who are very severe will be transferred to the hospital. But the people who are the moderate severe or low severe or just moderate, they don't need a lot of equipment. They don't need a lot of oxygen or something. Can be transferred to the temporary hospital and field hospital. So it's set up. We set up temporary hospital in this at school as the creation center, at school or creation center at university. We use some space for setting up the temporary hospital and setting up the temporary beds, yeah, and the place for transferring the people who get infection. Some Thai herbs have been used for primary care as the government allowed to use them for COVID-19 treatment. And risk people are tested. The screening of COVID-19 by healthcare provider. COVID-19 vaccination has been provided to all people. The government provides financial support for producing COVID-19 vaccine. And mRNA vaccine is made in Thailand. It's coming soon. The latest developments of Chula, we call Chula COVID-19 vaccine. Yeah, we produce mRNA vaccine. It's gonna be the newest vaccine that made in Thailand. Yeah. It's different from Baya vaccine, and it's different from the orange pill vaccine. It's different. This one is just, we invited the professor from America to cooperate for producing mRNA vaccine. Yeah. With respect to limitations of the policy, fatigue happens among healthcare providers. Shortage of healthcare workers occurs during the pandemic crisis. Although the government tries to launch the policy about production healthcare workers, it may not serve in the crisis in time. Mutation of the virus leads to a decrease of vaccine effectiveness. And awareness and concern among people are keys to alleviate the outbreak. Outcomes of the policy. An increase of volunteers emerged during the pandemic crisis. Collaboration happens in society. All sectors, community leaders, health volunteers infected people and their families have cooperated for preventing the transmissions. Internet network has been improved as people need to use for communication, online shopping, online study, online working, online meeting, online selling, and etc. The newest COVID-19 vaccine has been produced. According to the outcome of the policy for the pandemic, outcome of the policy are divided into two categories. The first, short-term prevention, and the second is long-term prevention. For the outcome for the short-term prevention, the COVID-19 outbreak has been decreased. The infected people will not spread the contagious virus to others. Few hospitals or temporary hospitals are used for the infected people to stay for primary health care, and for contaminating to others who are not infected. Imported COVID-19 vaccines are used for frontline healthcare workers and people who are at risk. For long-term prevention, COVID-19 vaccine has been produced and will be used in our country entirely.
Sorry, ma'am, your time is 2 minutes more.
Okay, thank you.
Yeah.
Thank you for reminding me. The newest vaccine will be produced to mitigate the variant virus or coronavirus mutates. Medical technology will be improved continuously. People have learned from the COVID-19 crisis, and they will know how to protect themselves in the long run. The production of healthcare worker will be increased. And the motivation for healthcare workers will be concerned for sustainable tasks. COVID-19 vaccine has been injected in all people entirely. Healthcare provider will be enough if the outbreak happens. Troops of healthcare providers will be prepared for the outbreak. Medical equipment will be enough and ready to use at all times. And target of the policy. Collaboration is a way to drive the policy for reaching successfulness. Highlighted prevention. The actual role to prevent the COVID-19 is the role of everybody. Individual concern is a key to prevent the pandemic. See, we should cooperate between policy, people, healthcare provider together, and then we will eradicate the COVID-19 together. Okay, for my topics is finished now. Any questions?
Okay, thank you for the interesting presentation. Yeah, with the proactive policy, we have found the Thai Channel Mobile. There is a good application, and there is so many strategy that the presenter, the speaker said, how to managing the COVID-19 in Thailand. Also, Thailand has the Chula-COVID-19, the mRNA vaccine to protect their community. Overall, the actual role to prevent COVID-19 is the concern about the individual concern. Yeah, that is an important thing, I think. Yeah. Okay, let's check the question for you, Mrs. Supapong, in the chat box. We have found that a question about from Rasna Sultan. Maybe this is about how the government managed to control people health-seeking behavior. I think you can answer this related, but there is we have a question from Mem Kalsum Samsudin. This is from Malaysia, I think. Yeah, and he asking about you. Could you share with us how to regarding the measures implemented by the Thailand government to ensure public compliance to the DMHTT policy? That is the interesting strategy, I think, in here. Maybe you can answer that, please.
Yeah. For DMHTT, DMHTTP, we can measure by looking at the decrease of COVID-19 or the number of people who get infected. Yeah, who get infection. So we can see from the people who get infection from COVID-19, we see the number of people who get. And every day the government try to announce about the number of dead people, the number of the people who get infected, and the number who get better after treatment. Yeah, so we can follow the number of the patients or the people who get infection. Yeah, can be the measurement.
Okay, thank you. And the next question, yeah, we have the raised hand from Tengku Musaddek. Maybe you can directly asking to the speaker, please.
Could you please turn on the microphone?
Yeah, you still unmute, Tengku. Sorry.
Oh, I'm sorry. Thank you very much for Ms. Eka and Ms. Supapon. Thank you for having me. I just want to asking about the topic, and it's about your country, especially about how the country in Thailand make the health worker problems, especially like a fatigue and maybe any limitation about health worker can be solved. How the contribution from the academician happen in Thailand. Thank you.
You mean how the government solve the problem about healthcare worker shortage, right? You mean how the government do for the healthcare provider shortage? At the moment, the government try to provide a scholarship for the students who are interested in.
No. Sorry, I am interested about. I mean, how to, the country supply the health worker.
Supply.
Yeah. Supply
Yeah,
the health worker.
Provide the health worker. Yeah.
Yeah, providing the health worker into facing the pandemic.
Yeah, we got problem. Yeah, we got problem with this supply because it's not enough, and then that's why the government established temporary hospital in every area in Thailand, in the province, in the district, in the sub-district. We set up the temporary hospital in the sub-district and encourage healthcare health volunteer to help the healthcare worker. We at the moment in the past we have health volunteer in every sub-district in Thailand. They can help the staff. They can help the staff in the temporary hospital that we establish in every sub-district in Thailand. Yeah, we solve this kind of shortage. Yeah. Healthcare provider. Yeah, in the community will do it, and the community leader encourage other people in the community to help together, and the volunteer happen. You know, it's happened. They are not trained about health, but they learn how to help the staff. They learn how to help the staff, just short training and then do it. Yeah, it's happened in every area in Thailand in last 3 or 2 months. Yeah. At the moment, Thailand is better than before. We have crisis. Yeah, around 4 months before. Yeah, last 4 months, last 6 months, we had crisis, but now we are better.
Okay, thank you for the answer. Yeah, and we have the next raised hand in here. Okay, welcome back, Olivia. Maybe you can asking your question in this part. Yes, yeah, please.
Okay, thank you for the change, Miss Eka, and thank you for the explanation, Ma'am Supapon. I just want to ask a simple question, actually. If we look at your explanation about how Thailand solved the problem about COVID-19, well, it has a similarity in Indonesia, such as the HDP. I mean, we did the same thing. I mean, like, what is that? Yeah.
And
using distancing, mask wearing, and yeah.
It's the law in Thailand. It's become the law. If you do not use the mask, you will be fined, and it's illegal. Yeah, it's law. Yeah.
Well,
if you don't wear mask in public place, it's illegal. You will be fined. You need to. Yeah, it's become the law in Thailand.
Yes, I just wondering. The regulation in Thailand, is that really strong? Because we have a similarity resolution to resolve the problem, but from my opinion, the regulation is not really strong. Like the punishment is not being effective. That's it. That's what I want to ask. What makes the regulation in Thailand was so strong? Effective too.
But when first time when the government announced, people ignore. Okay, some people ignore. The police go to that people and ask them to give the fine and punish them, give them the punishment, and after that other people, we should follow the law. Yeah, but first time when they announced, nobody interested in, just ignore, just the law, just. And after that, we are afraid of that because some people get the punishment from the government. Then we need to wear the mask when we go to the public place. Even you are in the car, for 2 people in the car needs to wear mask, because the police will be in some spot. We will wait for you along the way. You need to wear mask. Over 2 people, need to wear mask in the car. But if you are alone in the car, you don't need to wear mask. But over 2 people and over need to wear mask. Otherwise, you will be fined by the policeman. It's illegal.
Okay, thank you, Mrs. Supapon. Yeah, maybe it is same, but not same, yeah, Olivia. And Thailand has a nice and a great program with the MHTT. Yeah, although maybe we can take in application of Thai China Mobile. Yeah, maybe in here we got a Peduli Lindungi. Yeah, that is our application in Indonesia. And I think it is answered by the question from the chat box from Ma'am from Ma'am Maria. Yeah, it is same like Peduli Lindungi. And the next raised hand, you are interesting speaker today. Yeah, from Eka Prahadian. please, Eka, you can asking directly.
Could you please turn on the microphone?
Yeah,
Okay,
it's
thank you very much, Mrs. Eka. So we are the same name now.
Yeah.
Yeah, the same name.
Eka, same
but,
name.
but different sex.
Okay, so thank you for the chance. I would like to know about the, as I know that the Thailand is one of the best country in the region, if I'm not wrong, who work with the drugs related problem, because many rehabilitation centers is based on the Thailand today. So is there any policy related to the COVID controlling among the drug user or among the drug rehabilitation center that developed by the government? Because as we know that a lot of the drug users living inside or outside the recovery centers, but at the time there is also what we call it relations between the counselor, the drug users, during the counseling, during the sessions. Of course, it will give impact to the COVID-19 infections. Is that any policy that Thailand have today to control specifically the COVID-19 among the drug user or the drugs rehabilitation centers? That's all. Thank you.
Oh, thank you for sharing.
Yeah. Okay, please.
Can I ask you? I just want to know, do you have a healthcare worker shortage in Indonesia? Is that the same problem? Eka.
Yeah, Eka, you Supapon's asking you, it is same in Indonesia?
Oh,
maybe you still unmute.
Okay.
Okay,
Yeah.
sorry. Yeah. Can you repeat again the Ms. Supapon the questions? Sorry.
Healthcare provider shortage happens in Indonesia.
The healthcare who work
Yeah,
with the
healthcare worker. Yeah, shortage happens in Indonesia.
yes, we have.
Oh, so how do you solve that problem?
So we have sometimes it's very often we have like a working group who working at the same the field or the same area, and then we try to capture that the problem among the worker, and then what kind of issue that we have in different place. It's like, you know, that we have a very huge number of provincial or the district and then the city level. Because different province, we also have the different problem, and then the culture, the traditions. Of course, we first of all, through the working group, we will capture and then raise the similar issue so that we can develop something that can address and then can use in the different type of the province or area. So that's in the very basic level. Of course, we will have the working group and discussion about the common issue.
I think in Asian country, we are ASEAN. We are ASEAN, so we can help to each other. It's like the crisis in India. When the crisis in India happened, Thailand, the Thai government sent the oxygen tanks to help the Indian people in India. Yeah, and after that we got crisis. And after that we need oxygen. But the oxygen tank in Thailand is enough. But after donation, we got the crisis. And I think if Indonesia need help from Thailand, you can ask for the government. I think the Thai government can help other country in ASEAN as well.
Okay.
We will help each other.
Okay, thank you, Ma'am Supapon. I think it's enough because the time is over now. And thank you very much for your presentation today. And we will continue to the next speaker.
Yeah. Okay, thank you.
Okay, you're welcome. Okay, participants and all here, the audience in here, this is the last but not least presentation, and we still have a time to hear and share information with the beautiful and charismatic woman from Netherlands, Professor Dr. Hebel Katarzyna M. Zabanowska. Goedemiddag. Welcome to Indonesia, ma'am.
Thank you very much.
Yeah,
Thank you for this
welcome.
invitation. I'm extremely honored and proud to be at this conference.
Okay,
And yes, especially that I have a PhD student from Indonesia, Hervanswa, who probably is in the audience and who is writing the PhD thesis about maternal care. So I'm double proud to be with you
we
today.
are proud too. We are proud to invite you here. It's very honorable can meet and sharing information with you in this conference. Okay, maybe we can start. Yeah, let me see your curriculum vitae in the screen. Professor Zabanowska is a professor of public health leadership and public health workforce development at the International Health Department, Maastricht University, the Netherlands. She is also the honorary member of the UK Faculty of Public Health and Direct Governance and Leadership in European Public Health Program. She has published around 200 scientific articles in peer-reviewed journal, and she is the past president of the Association of the School of Public Health in the European region, an academic board member of the Studio Europe at Maastricht University. She served as a World Health Organization expert in the area of public health leadership, public health workforce development, and planning and public health system. And today, she will share with us about how to bridging gaps in public health competency-based education lesson from the COVID-19 pandemic. This topic is very important to us. We can learn to solve the problem in community related with COVID-19, of course. So all participants, don't miss out of this information and let's listen in carefully. And don't wait again. Welcome to Professor Zabanowska. With all due respect, please, the time is yours now.
Thank you very much. And I will share the screen. Yes. So if I may start, when I was thinking what to share with colleagues during this conference, I was thinking about bridging gaps. We are in a specific situation now, and the COVID pandemic, and I've listened to several presentations now and how you work and struggle with the pandemic, but actually it is related to bridging gaps. And it's warm in your country, and maybe the picture that I show is a little bit different, but you probably think that we are at a certain moment in time and we are trying to move to a better future. And we are moving on our own, or we are bringing our colleagues together with us, our students, our communities, and our society, but it's not easy. So you have probably observed that we are also working differently, and we are leading differently, and we are learning differently. I would also like to address the critical competency gaps that we have encountered now due to COVID pandemic, and how this reflects on leadership education and training. And the motive of this conference is how to empower the communities and how to have impact on the communities. So what does the leadership education mean for us? So first, working differently means leading differently. We all have experienced a sudden and radical change due to COVID. We have all experienced social and physical isolation, and also the immediate shift to distance and online. A lot of colleagues had to work remotely in restricted workspaces for a long period of time, and there was a sudden push to digitalization. Look at the conference that we are having now. And this required new leadership qualities, especially empathy for another human being and flexibility. But it also required from us open and transparent communication. And you know how important it is to communicate when people are waiting what to do next, and also to communicate with our colleagues and how students, and how to make sure that in spite of being online in remote areas, they still stay motivated and want to perform and deliver. But we found ourselves in a very complex situation. And I like to show this figure, which is a causal loop diagram demonstrating the complexity of the COVID pandemic, the system thinking. While we touch upon one thing, and you know how COVID strikes, then it is all interconnected. Interconnectedness is one of the qualities of the pandemic. So when we look at health, we look at the health of the health workers, of our populations, at social interactions, at vulnerable populations, at interventions, and what government can do, at air pollution, panic and fear, and at economic markets, at international trade. It is all connected. And one of the qualities of healthcare professionals, public health professionals, is to being able to deal with complexity and interconnectedness. And here I would like to share with you the WHO ASPER. ASPER is the Association of the Schools of Public Health in the European region, the competency framework that was developed to help public health professionals identify the skills that they need in different areas. And this competency framework was developed together with WHO, and it is based on the systematic review of all competency frameworks worldwide, including those in Canada, in the US, in Europe, and in Australia. And these competences were undergoing systematic reviews by experts. What we come up with is the division of competences into three areas: content and context, and these are related to specific public health epidemiology, statistics, and public health regulations and law and One Health, and relations and interactions, and performance and achievement. And if you look more in depth, you see the areas which are covered in the competencies. So here in content and context, you see health promotion, law, policy, and ethics, and One Health and health security. And here the problems of pandemic and the competencies you need are included there. But also collaborations, partnerships, communication, advocacy, and then the performance. Because in order to be a public health professional, you need to know what is the organizational literacy and how to perform in a professional, ethical way. So we also look at these competencies from the position of three levels. And once you enter the field of public health, you are at the level of competent, but then you want to progress, yes, to the, let's say, middle management, and then it can be at the expert level. So what we did, we looked at the competences, and here I just gave you an example of collaboration and partnership, and how the competencies are described. yes, for instance, here, works across sectors at local, national, and international level in the organizations. But going further, we show how this competency is described for a level 1 professional, level 2 professional, and level 3 professional. So I encourage you, because in the presentation I give the link to the competency framework, to look at it, whether some of these competencies correspond to public health in your culture, organizational culture, and maybe to do some assessment, yes, for the people who work in public health, which competences are needed, especially now in the times of the pandemic. So what we have done with colleagues, we looked at the competency framework, which I presented, through the lens of COVID pandemic, and try to find out what matters most for public health workforce, for preparedness in the view in case of global emergency. So what we found that there are critical competency areas that we need to look at. And it is flexibility, motivation, and communication, and research, strong research analytical skills, but combined with ethics, empathy, and sensitivity to diversity. It's really interesting to find out through COVID that we need a blend of competencies, a blend of scientific, epidemiological, strong skills, and empathy. And that's why a lot of women did very well concerning fighting with COVID. If you look at the Prime Minister of New Zealand, for instance, she's a good example where she combined very well these competencies. So competencies that relate to preparedness and response, and strong leadership and adaptability skills, especially for preparedness in the context of global disease outbreaks and coping with uncertainty and unplanned events. We need transformative leadership. So when you remember the first slide, bridging the gaps, transforming, moving people from the situation where they are now, helping them move to a different situation. Like from, face-to-face reality, we moved to digital. But it requires communication. So what kind of communication? Emergency risk communication, to be able to provide up-to-the-minute information, which is based on scientific evidence. And it is so important. And I was at the meeting with Public Health France, and the colleagues were saying that it was really so important to communicate, but very often, and you are confronted with it, that we as public health professionals, at a certain time, we don't have enough evidence, yes, but we have to communicate. And we have to be honest and transparent and say that based on the current evidence and research information, we make decisions, yes, but sometimes we have to admit that then the decision could have been made in a different way. But the society, the community is waiting, and we need to trust the evidence that we have from research. So we need to be able to acknowledge uncertainty, be honest, open and transparent, and of course, demonstrate concern for emotional distress in the situation, be empathic, caring, committed, because the colleagues, communities suffer, yes, and they need to understand that public health professionals are there for them and together. So I mentioned leadership. And I think that you in your programs also devote some time to develop competencies of leadership, which is the skill that nowadays we need, but not top-down, the control type of leadership, but horizontal leadership, transformational leadership that really looks at the society, at the community, and tries to empower the people to cope with uncertainty and complexity. And here is an example of the leadership training at Maastricht University, where we try to teach the students or professionals how to bring change. We use the transformational leadership or change leadership model. I'm not sure if you are familiar with the Kotter model of change. And we develop groups of professionals or students. We like interprofessional groups that people can exchange. And each group works with a different health challenge. So some groups may work with anti-vaxxers and what to do, how to communicate. Others can talk in their group about the limitations and regulations related to COVID and what government should do. And then they try to go through stages, identify the problem, then what is the evidence, and what should be done? How can we best introduce change? And then at the end, once they are ready with proposing changes, they write policy briefs or they present and show how the change can be implemented. So this is really very helpful because they put hands-on practice. And at the same time, we coach them and support with mentoring. So maybe those more experienced colleagues or professional coaches support the colleagues who are in the course so that they are stronger and they can face the challenge and they can introduce change in a better way. So leadership is not just something that we are talking about. Leadership can be developed, trained, and supported. I have said a lot about communication, and I like this slide. In order to influence the community, yes, and this is a motto of your conference, we need to rethink science. We need to bring it closer to the community. We need to speak a different language, the language that the society will understand. So a lot of attention and the competency should be towards knowledge translation. Yes, so bring it closer, interact with the society, use the language that the society can understand, practice it. Sometimes we are closed in bubbles or silos that are related to our specific discipline. But there is different time now. So again, we need to bridge the language of the policy, the jargon, to bring it closer to the society. And here is a very nice picture that is from the National Institute of Public Health in the Netherlands. And they really did good job. When they were trying to introduce the changes and regulations due to COVID, they really appealed they did that through social sciences and psychological sciences. They appealed to the behavior of the citizens, and they really worked with behavioral and scientists, sociologists and psychologists, trying to convince people to behave in a specific way. there were teams that were working how to communicate and how to make people behave in a specific way. But they have a very nice leadership academy in the National Institute of Public Health. And they always say that we need to bridge. We need to bridge our knowledge with the society through building different networks. We need to do it through the action-oriented learning. We need to bring new talent. We need to innovate and collaborate with people and connect with the society. So really bridging is something that we need to do as public health professionals. And now for the post-COVID era, we need a public health professional who is able to transform and to bring others to that other, better future. And I would like to describe this person, one of us, one of you. It is someone, and I'm sure that you recognize yourself in this description. It is someone who builds and strategizes the knowledge base and infrastructure for effective public health interventions. Someone who is able to activate system-wide and cross-sectoral networks of relations and interactions that enable the implementation of comprehensive response. And someone who delivers high-quality achievements in public health. Someone who is interprofessional, interdisciplinary, resilient, and digital. And with this, I would like to thank you very much for the attention. And once again, I'm very honored and proud to be part of this conference. I would love to see you all, but unfortunately, it's not possible. Thank you very much.
Yeah, thank you very much. Also, it's very educated, yeah, to hear your presentation in here. And thank you for your brilliant presentation. And we can continue this session with the discussion. Maybe if you have the question for Professor Zabaswa, okay.
You can call me Kasia.
Kasia, okay, nice, Kasia. Okay, we can see at the just the opinion, yeah, the great presentation from Mr. Muhammad Ikhwan. It is a great presentation. Yeah, that is for you. And it's very proud to receive and hear your presentation because it is about how to educate and bridging the gaps. I think the participant can asking something for the Professor Kasia because it is
one question from Herwansa.
Herwansa? Oh yeah, hello Herwansa. You have raised your hand. Okay, come Herwansa.
Thank you, Ibu Eka, because I think while we are waiting for another participants who perhaps they're still preparing the question for Kasia, let me kick off. So thank you, Kasia, first of all, for supporting our conference. I really appreciate and such a great presentation, as always. You are doing great thing. So Kasia, one question perhaps regarding the leadership in public health experts, because for instance, in Indonesia, take one example, during COVID-19, lots of programs already implemented, but it's hard, I mean, to fully implement it and apply in the society. One of the problems perhaps is trust from the community for the government. Because sometimes, from my opinion, my personal opinion, sometimes the policy change suddenly. So without considering the evidence base or the situations in the community. So perhaps you can share your thoughts, what the institutions, in this case, university, can contribute to raise the trust from the community in response to this pandemic.
You know, thank you very much for your very relevant question. And you know that in leadership, trust is one of the most important values. Leaders try to build trust, and it takes a lot of time and effort, but it's very easy to lose trust and then build it again. And rightly said that we often lose trust with governments, who sometimes in a chaotic way try to introduce new policies and then they change and the society is not happy, and that happens everywhere, not only in your country, right? But what is important to build and support community leaders. And as academic institutions, yes, you should have some kind of outreach or possibility to include community leaders who may have good impact on the society. And I don't know if this will be some kind of professional training that is offered or through research, where these community leaders can participate and they can get empowered that their work is meaningful. And through this type of activity, they can have impact on the societies and communities, and slowly build trust from the university through community leaders to the community. It might be a way in your culture.
Yeah, absolutely agree. Yeah. One thing that the most important issue that's in this conference, perhaps lots of people working in academia and also in the government. So it's such a great opportunity to, to combine or to make a deal between an academic and then the policymakers in order to generate a good policy in response to these situations, perhaps.
Mm-hmm.
Yeah.
Thank you.
Yeah. Thank you, Kasia.
Thank you very much. Thank you, Hermancha. He is my PhD student that I have mentioned at the beginning. So please congratulate, because the 2 scientific articles are now under the review.
Okay, congratulations, Herwansa.
And there is a question in the chat.
Yes,
thank you. Any examples
yes.
of knowledge translation concept applied in the Netherlands communities? Okay, thank you. I would say, concerning knowledge translation, there are, you are colleagues from the academia, and there are very good knowledge translation frameworks. If you look at the publications of the European Observatory on Health Systems, that is the organization, and you can look on the webpage, Google this name, and knowledge translation frameworks. And there you have good information on how to do best knowledge translation. There are also specific competencies for knowledge translation, yes, that are related to evidence-based collection of data and communication skills, and how to communicate to different levels of public, yes. And I can also send an article, or I don't know, there is an article that another PhD has written about the competency framework for knowledge translation. And it is also related with leadership skills. The article was published in a public health journal of the UK Faculty of Public Health. So I would suggest to look for the frameworks and get acquainted with the skills you need to have in order to translate best, depending on the audience, depending on the stakeholders, and depending on the type of information and material that you want to translate. But there is now no knowledge development without translating it to a wider public.
Okay, thank you, Kasia. And now you have a question from our Dean, Professor Ida Justina, and she need know about what if the exciting leadership no longer giving trust to the community, and what do you think about that? You
can you repeat if?
Okay, the question is, what if the exciting leadership no longer giving trust to the community?
Okay, the exciting leadership no longer gives trust to the community.
Yes. So what do you think about that? Okay, thank you.
Yeah, thank you very much. So as I hear this question, on one hand, yes, leaders try to be motivating, yes, and show excitement to the community, but the community thinks, or maybe is disappointed and loses trust because the mistakes were made before. Yes. So what I can add, that the most important for leaders are two things. One is consistent value power, showing your strong values that you consistently show in different situations, that you don't change. Then community trust. And another one is expert power. Expert power is how the community recognizes you by the knowledge you have. And then a combination of these two, consistent value power and expert power, are the strongest to build trust. If you are able to wrap it up nicely, if you have the way to communicate, yes, and motivate, then that's very nice. But you see, these two are needed in order to keep trust, because people will quickly recognize that someone is charismatic and can. Charisma doesn't mean much if it is not supported by knowledge, by expert knowledge and strong value system.
Okay, yes, we can note it, value and the expert. Yeah, thank you for the answer, Kasia, Professor. And maybe from another participant, we still have a time to giving the question, or maybe you have full with the completed explanation from Professor Kasia today. Okay. No question more? Yes, the answer from our Dean. Thank you for the answer, Professor. You can
Was it helpful, this answer? I have a question to the Dean, if that answered your question.
Okay. Yes. Okay. I think no more question for this session.
Thank you.
Yes, thank you very much, Prof. Kasia. Maybe we can finally, Alhamdulillah, we come to the end part of the session. And before I giving back to the MC, we would like to say thanks again to all of the speakers. Thank you very much for the informative and interesting talk in your presentation today. And also thank you very much to all participants for the active participation. Hopefully the presentation will be beneficial for anyone in here. And let me closing this session. Thank you very much with one pantun to complete this plenary session. If you want to take a vacation, don't forget to invite your friends. Thank you so much for your attention. See you again in the next conference. Assalamualaikum warahmatullahi wabarakatuh. Giving back to the MC.
Thank you so much, Dr. Eka. You have guided this session very good. And to our speakers, thank you so much for sharing idea about the topic. We hope all of us always in good condition, and someday we can meet again together in the other opportunity. Give applause again to our speakers and moderator.
Okay, so roses are red, violets are blue. We'll finally reach the end, but tomorrow this conference will continue.
Thank you so much for your excitement. We apologize for mistake and see you tomorrow morning.
Wassalamualaikum warahmatullahi wabarakatuh.
Solo digo
Pisangku belum masak, masak sabigi di hurung bari-bari. Masak sabigi di hurung bari-bari. Masak sabigi di hurung bari-bari. Masak sabigi